Mr. Chairman, we're live.
Thank you very much. Welcome to Labor and Health, everyone in the room and in virtual land. We appreciate your attendance today. Labor and Health, we appreciate everybody being wide awake. I don't see a lot of cups of coffee there, but if you need it, feel free to go get one if you need one. Go ahead and take a roll, Mike.
Senator Bouchard,
Excused?
Senator Furphy.
Here.
Senator Hutchings,
Here.
Senator McCune,
Here.
Chairman Anderson.
Here.
Chairman Baldwin, I apologize.
Yeah, well, whoever I am. I'll be whoever you want me to be today. Yeah. Okay, we have two bills in front of us this morning. We're going to do some special things this morning just to make sure we get all the testimony. As you can see, there's a lot of people here. There's also a lot of people online. For both bills, we're going to follow the same rules, and that would be beyond the presenters, the people that present the bills. We're going to have a 3-minute testimony limit. That way we can make sure we get everybody and we get through everything. And I know for some people that's long, and for some people that's short, but it'll be important so we get all the testimony on both of these bills, and we can get both of these bills done today. We get them worked. This is the last day for testimony or for any bill to come out of committee. So this is it. This is your last shot at us. So we want to make sure that we get to hear everybody. Right now, there's not as many people in virtual land as I expected. I'm sure there'll be more. But we're going to start. Who is going to present these bills? I don't see our representative here. There he is. I didn't recognize him with the hat. The first bill for our consideration this morning is House Bill 161, Human Life Equality Prohibiting Discriminatory Abortions. Welcome to Labor and Health Representative. Go ahead and introduce yourself to the public and go ahead and present your first bill for us.
Thank you, Mr. Chairman. Representative John Benedict Romero Martinez, and I bring to you today House Bill 161, Human Life Equality, Prohibiting Discriminatory Abortions. And thank you for the opportunity. I know you all could read, so I'm not going to read the whole bill. It's not too long. Basically, what we're looking at here is prenatal health. Prenatal health. And so a brief example would be a woman goes to a place to get a genetic test done, and the genetic test shows that the child has Down syndrome, or it's a mixed race or something like that. And so for that reason only, they choose to have their unborn child killed. You could say terminated if you want to try to be dehumanizing, but basically you're killing a child. This bill prevents that. There were some amendments made. I did not have the vision to get all the definitions in. So with the help of the good chair of Labor, Health, and Social Services in the House side, we included definition of anomaly and went through the House for second, third reading. And we bring this to you today, and I stand for questions. Thank you, Mr. Chairman.
Thank you very much, Representative. Questions, committee? Very good.
Yeah.
Oh, Senator Furphy, go ahead.
Thank you, Mr. Chairman. Representative, is there any disability that may make sense to have an abortion? For example, if the fetus is shown to not, as we heard in testimony, not have a brain, etc., is there a reason to go ahead and have an abortion? I just am interested in your input on that, because you're making it clear with this bill that there is no disability that could not be the purpose of an abortion. Thank you.
Go ahead, Representative.
Thank you. Thank you, Senator Furphy. I'm not a doctor, but I would think that's a great question. I think in that situation, we're in a gray area, I guess, where the child, the fetus, the unborn human being is alive, but doesn't have a brain. So I think that's what a lethal fetal anomaly would be. So a condition diagnosed before birth that if pregnancy results in a live birth will reasonably certainly result in the death of the child for more than 3 months after the child's born, probably in this situation, maybe even a lot quicker. I don't know, I would imagine. So I think that's covered in the bill. Also, I think that's a situation where, I mean, I think that's covered under that definition. So it's a tricky situation because obviously the child's gonna maybe have a heart and everything, but no brain. So I hope I answered that, but I know there's someone who has more expertise than I do in the medical community. Thank you for the question.
Further questions? And I would submit that on page 5 there, exactly what he was reading in the bill, the lethal fetal anomaly is covered with a child born without a brain is one who would not be expected to survive 3 months, who would not be expected to survive, frankly, for a very long period at all. And I think that disability and that portion of the populace is covered under that on right at the top of page 5. Senator Hutchins, you had a question?
Thank you, Mr. Chairman. Representative Romero Martinez, are you aware that there's a rise in prenatal screening and tests in Europe and in the United States where the number of Down syndrome children have significantly decreased? In Iceland, it's almost at 100% because they do abort their youth when they are tested for Down syndrome.
Go ahead, Representative.
Senator Hutchings, I'm flipping through my paperwork here. In my brain, the answer is yes, I know that. I can't find the citation, but I know that there are some countries where, from the top of my head, that they are doing this at, I think the number is 100%. And so what we're seeing in these countries and in the United States, if I'm not mistaken, I think the number is 65%. So this is not just kind of important. This is urgent and important.
Thank you.
Thank you, Mr. Chairman.
Further questions, committee? No further questions, Representative. We'll let you relax, sit back and listen to testimony for a little while. Okay. And I would we're going to start here in the room, actually, hearing testimony on this bill. And I would remind everyone what my intention is to do 3 people at a time. 3 proponents, followed by 3 opponents. If we may, that way we'll keep it even. If we run out of either or, then we'll just do whatever's left. And then we'll follow that same thing online. When we get to the online, that's what we'll do. But there's gonna be a 3-minute time limit. So we can get through. We're already almost 15 minutes in the meeting. So we want to keep rolling. So if I can have actually the first 3 people up, proponents, people that support the bill that wish to testify, come on up and have a seat up here. Go ahead and introduce yourself. And I think we've seen you a time or two this year.
Thank you, Mr. Chairman, members of the committee. I'm Mike Lehman. I'm representing the Catholic Diocese of Cheyenne. Earlier this session, the legislature passed House Bill 111, access to anatomical gifts and organ transplants. That bill prohibited discrimination in the provision of healthcare services and insurance for organ transplants and related procedures based on a person's disability. That bill passed both chambers without a single no vote, because our good legislators recognized that it is possible for certain providers to discriminate against the disabled in an unjust manner. Mr. Chairman, some question the need for House Bill 161. To them, I would simply say, pull up the website of your local OBGYN providers and see what kind of conditions they advertise doing prenatal screening for. And think about what it means to be screened. See how many times the words Down syndrome are mentioned as something that can be screened, and then realize that we can't screen Down syndrome. We only screen people who have it. Talk to any woman who has a Down syndrome child and ask them about their experience of some healthcare providers. Now, some resist this bill because it will be difficult to enforce. That's true for a lot of reasons. I've mentioned in testimony before that the state hasn't gone out of its way to provide oversight for abortion providers. There's a lot that we don't know because deep down we haven't really wanted to know. Enforcement will be a challenge, but at least, excuse me, it will allow for retroactive action. And that could save lives if it prevents even one provider from encouraging an abortion for expectant parents. We have a long way to go to further our debate on this issue. We can all recognize that if a child can be diagnosed with a disability in the womb, he or she can also be discriminated against because of that disability. He or she is in need of legal protection. With that, Mr. Chairman, I would stand for any questions.
Thank you. With a minute to spare, you did very well. Questions? No questions, committee. Thank you very
Thank you,
much.
Mr. Chairman. Maybe I could use that extra minute on the next bill.
Yeah, your second time, right? Yeah. Representative Nyman, is I'm saying that right? I'm still learning all the representatives' names. I apologize.
That's very good. Yes, that's exactly right. Thank you very much, Mr. Chairman.
Go ahead, sir.
I stand in support of this legislation, and I come to reflect the views of the constituents that elected me to this position, the vast majority of which stand firmly for the protection of life. And they have asked me over and over again, as I've received information from them, that they want me to relay their support for this legislation, and that life is precious. And that life, and making those decisions and trying to come to a point where we say, this is savable or this is not salvageable. I struggle with the idea that even we have to have this legislation and come to a point as a society where we say, you know what, this is worth saving, or this is not worth saving. According to our Constitution, our Bill of Rights, we have the right to life, liberty, and the pursuit of happiness, or the ownership of property. And life does this precious little, liberty, excuse me, does this precious little good if we do not have life to enjoy it. And so I don't want to take any more of your time than that. I support the bringer. I support this bill. And so do the vast majority of the people of my constituency that I represent. And I would stand for any questions.
Thank you. Questions, committee? No questions. Thank you. You had 2 minutes to spare. You might be able to sell those to somebody in the audience. Thank you very much, Representative. Are there any more proponents, folks who support the bill that want to come up right now? Okay, opponents, if we got 3 people that are in opposition to this bill that want to come up, or anybody wants to come up here in the crowd? You guys are way too quiet at 7 o'clock in the morning. Okay, Amanda, we have nobody here. Let's bring in 3 opponents, 3 people who oppose the bill. If they're there, if those people who are opponents of this bill can raise their hands in the virtual waiting room right now, and we will let you in to testify. Silence has become a hallmark of committee meetings.
Mr. Chairman, I've let in 3 individuals.
Great.
So if they can turn on their videos, and we do have 2 more with their hand raised.
Great. We'll go from left to right. I see former Representative Halverson, if you would like to go first. I think you heard what we said. We got 3-minute time limits, so we don't want to hear your dog bark in the background today, but go ahead and give us 3 minutes of testimony, please.
No guarantees on the dog, Mr. Chairman, sorry. Good morning, Chairman Baldwin and members of the committee. My name is Marty Halverson, and I am representing the thousands of Wyoming members and friends of Wyoming Right to Life. We urge your aye vote on this bill. Is the committee aware that there are millions of families who have adopted and are willing to adopt babies diagnosed with trisomy 21 or Down syndrome? A prenatal test for Down syndrome is notoriously unreliable, as it can only show an increased likelihood, not whether it is actually present. And Down syndrome is only one of hundreds of disabilities that can be diagnosed in utero, along with although with varying levels of accuracy. A prenatal diagnosis of a disability is no reason to abort when there are thousands of families willing to adopt these special needs children. Mr. Chairman, that we are even talking about actually prohibiting abortions based on sex, race, color, national origin, or ancestry should alarm and chill everyone in this room. This prohibition should be universally agreed upon. I'll conclude with this. Every baby is a wanted baby, whether it may or may not be born with a disability or the wrong gender. This boy or girl is wanted, perhaps not by the birth mother, but most certainly by another loving family. And every time we've heard testimony on this bill, anencephaly has been brought up. And I want the committee and everybody listening to realize there's sprouted up all over the country perinatal hospice centers. And these are to service the families and the babies that are not expected to live, who are born with such a disability that their life expectancy is a matter of hours or days. The hope of Wyoming Right to Life is that these babies are born, baptized if that's your inclination, and live out their lives in a hospice situation. The parents, the mother may or may not want to deal with this, but there are thousands of volunteers around the country that service perinatal hospice. And we urge your support of this bill. A disability should be absolutely no reason for an abortion. And I thank you for your time this morning.
Thank you, Ms. Halverson. Questions for Ms. Halverson Committee? Seeing no questions, thank you very much. I believe the next one will be Larry, and I apologize. I could not see your name, sir. If you could introduce yourself, and I can read Larry from my desk, but I can't read your last name. Go ahead and introduce yourself.
Mr. Chairman, I want to be sure I'm Dr. Larry Miley, and first of all, thank you for allowing us to testify by Zoom. I am opposed to this bill, and I'm not sure whether you want the opposition jump down or not.
You're fine. Go ahead. You have 3 minutes.
Okay, thank you.
No hurry. No hurry. Just 3 minutes.
Well, first, I'm a board certified pediatrician and was trained at Children's Hospital in Denver. And briefly, I practiced pediatrics for 13 years and then was recruited to come to Wyoming by the Department of Health to head up what was called as medical director of the Improved Pregnancy Outcome Program. During my career, at one time, I was head of the Division of Health and Medical Services, which is now the Department of Health. And I presented the Health Department's budget to the Joint Appropriations Committee, and also the health program to this committee, to the Labor, Health, and Social Service Committee. Also, sir, I was in the Wyoming legislature for 10 years, and I ran as Republican. And in those days, when I ran, the Republican tenets were limited government, individual rights, freedom of the individual, and fiscal responsibility. I'm opposed to this bill and bills similar to this because of what I consider to be the unintended consequences of these bills. I think that there are a couple of precedents that have been set that I am concerned about, and the precedents have to do with, number one, the Wyoming legislature putting in place a process whereby they can question business practices, and the business and the question have to do whether these business practices what they believe, and that bothers me that the legislature feels like they can tell people what they can believe and how they can practice. The second thing that concerns me is that anyone that has been elected to the legislature evidently has the authority and the qualifications to put into place their personal beliefs. And again, I think that is a precedent that we have to be careful about putting into statute in the Wyoming legislature. The thing that concerns me is just, let me give you 3 quick examples. Let's imagine that electrician was elected to the legislature, and it's his belief that a pharmacist cannot fill certain prescriptions. So he puts into place beliefs to that effect, and they're passed by the legislature. Or let's assume that a dentist is elected and he believes that certain crops or business practices in a rancher, farm rancher business, he believes that certain crops should not be farmed. So consequently, he puts his beliefs into statute. And further, maybe a farmer rancher feels that they have the authority to and qualifications to tell doctors what they have to believe and how they have to practice.
Sir, if we can get you to wrap up in about 30 seconds, I'm sorry to interrupt, but go ahead.
Okay, well, I can understand that maybe you wouldn't want me to continue this. Anyway, my concern is that if these, there may be some unintended consequences, because if you put beliefs into statutes, then those beliefs are the law, and anybody that has contrary beliefs, no longer what they believe is lawful, and they can be persecuted, they can be fined, jailed, so forth. And I think that that then undermines the free speech First Amendment to the Constitution, in that contrary beliefs are no longer legal. I assume I'm out of time. Thank you very much, Mr. Chairman.
Thank you very much for your testimony. We appreciate your time. Questions for the presenter committee? One question. Senator McEwen.
Actually, I have 2 questions, Mr. Chairman. Thank you. My first question is, if we kill a 2-year-old child with Down syndrome, is that murder? And my next question is, do you realize the entire military system would fall apart based on your philosophy of I'm not a doctor, so I can't run things? Do you understand that too? Thank you.
Go ahead, sir.
Thank you, Mr. Chairman and Senator. I think we're talking about 2 different things here. Do I think that if a Down syndrome baby is killed, that it's murder? I'm confused as to how that plays a role here. And if a baby dies, a baby dies. Are you saying that that physicians are deliberately killing Down syndrome children?
Clarify the
That to me
question.
is abhorrent. I just that's not our role.
We'll get a clarification of the question here.
I guess what I'm saying is, first of all, the test is inaccurate. Second of all, we're not killing a fetus, we're killing a baby when we do the abortion. So my question is, if we're gonna do it when it's in the womb, why not do it when it's 2 years old? Maybe the mother decides in 2 years, this is too much work for me. And I'm just curious your thoughts on that.
Go ahead, sir.
In a case like that, it would seem to me that maybe that mother should have the option of adoption. In the womb, what we're talking about is evidently what you're saying is the fetus in the womb is a person, and I'm not sure that I actually believe that. Everybody, you have to define, I guess, when life begins. And there's a lot of different definitions of when life begins. And there's even the definition of the individuals who feel that life begins when the children are all grown and out on their own. So I'm not really sure where we are here on that. And my own philosophy when life begins is when the lungs are mature enough to sustain life. The question, I guess second question is, in the military, are you saying that, I don't understand, that you don't you have to be qualified to be a military general or in charge of the military? And I feel like the same thing applies to physicians, that you have to be qualified to do the job. I don't know. Was I qualified to be head of the Division of Health and Medical Services as a physician, and being the state health officer, and being able to provide the health department's budget to the Joint Appropriations Committee, or the health department's programs to the Labor, Health, and Social Services Committee? I don't know. I felt like the people that I worked with felt like I was qualified to do what I was doing. But the problem I've got here is that when people feel that what they believe should be the statute, should be the law of the land, and anybody that doesn't believe what they believe, not only is the contrary beliefs are no longer legal or lawful, but that those people should be discouraged from speaking out because they're really unwelcome in the state of Wyoming, because they don't believe what the so-called majority believes. And I'm not sure the majority believes that Wyoming should be a right to life state. But I know that I'm speaking in the minority there, and I know that the committee already knows how they're going to vote. The only thing I want them to be aware of, be a little careful of the unintended consequences, because you're opening up the door to a lot of people putting their beliefs into statute. And if they're controversial beliefs, I'm not sure that's a good program or a good way to run the government.
Okay.
That's just my belief, sir.
Okay, thank you.
Thank you.
Go ahead, Senator McKeon.
I guess my point is, as a battalion commander, you're in charge of diesel mechanics, cooks, as well as other artillerymen. I could shoot an artillery piece, but I can't rebuild a diesel motor. And the last thing you want me to do is cook. But I was still responsible for all that to make sure it got done. So I kind of take offense when you say we as legislatures are not qualified to look at a bill because we're not doctors. And I'll close with that. Thank you for your testimony, sir. I appreciate your time.
Thank you very much for testifying. We appreciate that. I see one further question. Ms. Volk, Wendy, I believe. Go
Good
ahead.
morning.
You got your.
Thank you for the opportunity to speak in opposition of this bill. I wanted to just let you know that I have had genetic testing during my pregnancies, and it wasn't to determine if I was going to have an abortion. I had a pregnancy at 42 years old, and there were some unusual things happening in my pregnancy. They wanted to make sure I was okay and that the child I was about to have was going to be okay. They did not even bring up abortion, so I wanted to first dispel that. It was really for the health and well-being of me and my pregnancy. Secondly, I want to say that laws that prohibit abortion or provisions of information on abortion services in the case of fetal genetic anomalies restrict women's ability to make decisions that are best for themselves and their families. I don't think any of us can put ourselves, nor do I expect our Wyoming predominantly male legislature to put themselves in a woman's shoes, and prohibiting abortion for specific reasons discourages honest, confidential conversations between patients and their providers. When healthcare professionals must question their patients' motivations for obtaining an abortion, patients may feel forced to withhold information or to lie to their provider, or they may be dissuaded from seeking care from a provider at all. This is very dangerous precedent, as Dr. Miley had referred. Laws that force doctors to interrogate a patient's reasons for having an abortion perpetuate stereotypes and imply that women, especially women of all different types of socioeconomic, cannot be trusted to make their own economic decisions or own medical decisions. Laws that force doctors to interrogate the patient's reasons for seeking abortions perpetuates the negative stereotypes and continued historical racial injustice for the provision of reproductive health care, and imply that women cannot be trusted to make their own medical decisions. I am very disappointed that Wyoming legislature does not trust women to make their own medical decisions, and I please ask you to vote no on this legislation. Thank you.
Thank you very much, Wendy. Are there any questions for Wendy Committee? No questions. Thank you very much. Amanda, let's go ahead and let in the next three people. Preferably proponents first, but let's just put in three people. I believe there's about 8 more left out there or so.
Mr. Chairman, I allowed 3 in, and then we also have 1 telephone number that I will have to allow to talk instead of letting it into the actual room.
Okay, we'll save that one until the very end. We'll do that, the last testimony online. So I see 2 people up here online, and I apologize. It's very difficult to read your names across the wall here. I need to move my computer here. Maybe I can see it online. Can you see the first up there in the top left-hand corner? Tyler? Katie, is that correct?
That's correct.
Oh, okay, go ahead and introduce yourself. I apologize for not pronouncing your name right. And this new technology, it's very difficult to see the name across the room. But go ahead, Katie, and introduce yourself and go ahead and start.
My name is Katie Noyes. I apologize. I'm in my child's bedroom right now, kind of hiding from them. But I am here today to oppose this bill. Some of you may have heard me on some of the earlier anti-choice bills, but I'm a board certified family physician, and I serve patients in Teton, Lincoln, and Sublette County.
We lost our audio, Katie, for some reason.
Can you hear me now?
There you go, we got you.
Okay, I'm going to switch rooms, see if that works. So 95% of what I do is provide primary care for men, women, and children in my practice. I also help women who come to me with unwanted pregnancies. My job as a physician is not to insert my personal beliefs. My job is not to judge them. My job is to educate them and offer them their choices. And I explain to these women that their choices include parenthood, adoption, or abortion. And again, it's not my choice. It's not my judgment. It's not even my job to understand exactly why they're choosing one versus the other. My job is to help them make the best decision for themselves. And I do agree with Wendy that most women who choose to have genetic testing do not do it because they want to decide to continue or abort a pregnancy. They do it so that they are well prepared, that they can deliver in a hospital that perhaps has a NICU, which many hospitals in Wyoming do not have, if they have special needs. So I think that if we want to protect people with disabilities, let's provide services for them. Let's provide the funding, the occupational therapy, the physical therapy to support them throughout their life. I don't think this bill helps anyone with disabilities. And if we want to help reduce unwanted pregnancies, let's focus on really good sex education. Let's focus on helping men and women make good decisions about their sexual health. Let's provide easy access to contraception. And let's provide the citizens of Wyoming with access to providers that will provide them with unbiased factual information. This bill does none of that. I think we all really know what this bill is about. This bill, I think every legislator knows that this bill is unconstitutional and flies directly in the face of Roe v. Wade, which is current precedent in the United States. And states over and over try to slowly chip away at that ability for women to make a choice about a pregnancy. And
So we're going to give you about 30 more seconds here.
thank you, Mr. Chairman. So again, let's help people with disabilities. Let's help women make their own choices. And let's not criminalize physicians for providing unbiased information to their patients. So I do urge you to vote no on this bill. And I'm happy to answer any questions you might have.
Thank you very much, Doctor. Any questions for Dr. Noyes committee? Senator McEwen.
I want to ask you a question. And the question is, you cite Roe v. Wade and call this unconstitutional. Roe v. Wade is a precedence, has nothing to do with the Constitution. And I could argue with you that abortion is unconstitutional at any point in time. Life, liberty, and the pursuit of happiness. So wouldn't you agree that this piece of legislation has nothing to do with the Constitution or being unconstitutional?
Go ahead, Dr. Noyes.
Mr. Chairman, I agree that Roe v. Wade is not in the Constitution. Women have abortions for a variety of reasons. Usually it has nothing to do with disability. It often has to do with finances, feeling unprepared, not having resources to support existing children. I think we all just need to step out of the complex decision that women have to make for themselves and really think about whether we're trying to insert our personal beliefs into someone else's life.
Thank you very much, Dr. Noyes. Any further questions, committee? No further questions. Thank you much for taking time to testify this morning. We appreciate it.
Thank you very much for your time.
Thank you. Can anybody read the name of the next person? I'm sorry. I'm sorry, ma'am. I was hoping by bringing it up on my screen, I would be able to see it, but I have a time delay in it. And I'm still seeing the last testimony. So
Her first name is Christine. I can't catch.
Christine, are you still there?
I'm here.
Go ahead,
Christine.
introduce yourself. I apologize. I feel bad.
Oh, no problem at all. My name's Christine Lichtenfeld. I'm in Lander, and I am an attorney. I am also the director of the nonprofit Chelsea's Fund, which helps people access abortion services. And I'm speaking to oppose this bill. First, I do think it actually goes against the values that Wyoming has, which, as Dr. Miley and others have said, does value civil liberties, people's independent decisions to make their own decisions, something that the legislature has even recognized in WyoStat 42.5.102. It recognized that self-determination and procreation shall not be restricted. And that's exactly what this is trying to do. It's also, we have the Wyoming Constitution, Article 1, Section 38, that recognizes our right to make our own healthcare decisions. And that's exactly what this is about. And yes, this bill is unconstitutional. The Supreme Court, binding Supreme Court precedent, Roe v. Wade and Casey, are very clear that a state may not prohibit any woman from making the ultimate decision to terminate her pregnancy before viability. This bill is trying to do that. It does not address viability at all. It's merely saying if for any reason that a person, one of the listed reasons, decides to have an abortion, then that's not only illegal, it's criminal, which is really, that makes this bill clearly unconstitutional. And, and Wyoming recognizes the primacy of the Supreme Court of the United States in constitutional areas. It's firmly established in our law by judicial decision and in our own state constitution, Article 1, Section 37, and recognized in Doe v. Burke, 513 P2D 643. So we are compelled to go along with the federal constitution in this case and the Supreme Court precedent. That is how our legal system works. Secondly, as I suggested, this bill is horrifying in that it criminalizes an entirely legal act. Having an abortion is currently entirely legal and constitutional, and yet it's making someone's decision based purely on their thought, on their motivation, their decision, making that illegal. So it's making the state into a thought police. And I think that is something that is terrifying, for anyone from whatever position you come from. Third, I would say that, people's decisions, as Dr. Noyes suggested, and as I have heard, speaking with hundreds of women who are considering having an abortion or seeking assistance with it, it's based on a very real and careful analysis of their own situation, and their own situation differs. And I've had numerous people tell me when I'm talking on the phone to them, I never thought I would have an abortion, but I need to do it given my situation. I'm barely surviving with my 2 children that I already have, or I already have a disabled child and I can't have a second one. I'm not in a position to, and or a parent suggesting that they didn't think they'd want it, but it's the best thing for their child, their 14-year-old daughter. There are so many reasons, and I should mention that, the nationwide survey says that 59% of women who have abortions already have children, so they know what they're doing.
Have you wrap up here in the next 30 seconds if you
Yes, I will. Thank you. I would suggest that if we really want to stop discrimination based on sex or national origin or disability or things like that, we should really focus more on the people who are already living, and there is a dispute as to when when a being becomes a human being. So let's work on the people who are currently disabled. Wyoming stands 33rd in a study as far as providing services, and women with their pay likewise are very low inequality there. I oppose this bill. It's unconstitutional. The legislature shouldn't be passing an unconstitutional bill. Thank you very much.
Questions, committee, Senator Hutchins?
Thank you, Mr. Chairman. I'd like to just kind of reiterate some things and especially some facts in the Constitution. Number one, governments were instituted to secure the life, liberty, and pursuit of happiness of people. So we were instituted to do this. Article 1, Section 38 of the Wyoming Constitution, Section C says, the legislature may determine reasonable and necessary restrictions on the rights granted under this section to protect the health and general welfare of people, so on and so forth. When we're talking about abortion, we keep hearing that we're preventing a woman from doing something with her own body and something that she has a right to do. That's all fine and dandy. But what we're trying to do is to preserve the life within the life. So we're trying to prevent a person from making a decision for terminating someone else's life based on a disability, sex, race, color, and so on and so forth. And those are indeed in our constitutions. The US Constitution is the supreme law of the land, not Supreme Court precedents. And in our Constitution, you are correct. In Article 1, Section 37, we do recognize the US Constitution as the supreme law of the land. Thank you very much, Mr. Chairman.
Thank you. Further questions, committee? Any reply? You wish to finish up on statements, or go ahead. Christine, go ahead. Yeah, if you've got a reply, I'm sorry, we must have lost your audio.
Mr. Chairman, my reply would be that two parts. The Supreme Court's interpretation of our Constitution is what can tell us in many ways what the Constitution is. We are bound by that, and that's just the way the law works. And second, right now, viability is the standard is the time where a state can start regulating. Secondly, I would offer that the determination, people's views of when life begins, seems to be very bound in people's religious view of when life begins, and I entirely respect that people's religion leads to different assessments of when that occurs. However, that's not, religion is not, everyone's supposed to be able to exercise their own religion, but not force their own religion on others. That is the Constitution. And at this point, viability is the standard where the state can start regulating. And this is not the case. I would also suggest that even Utah, which has a statute similar to this one, it's a statute that is not actually enforced currently because they recognize that it's unconstitutional, and it's a contingency. It's contingent based as to when it would become effective based on decisions made at the Supreme Court.
Short follow-up, Senator Hutchins.
Yes, Mr. Chairman, quick follow-up. When we talk about viability, I don't recall actually in my testimony bringing up, or my comments bringing up religion at all. You brought that up. And number two, when we talk about viability, as soon as that sperm hits the egg, it's viable. Are you really talking about sustainability, possibly outside the womb? But as long as it is in the womb and it's progressing in its life, at this early stage, it is indeed viable. Thank you, Mr. Chairman.
Okay, everybody take a deep breath on the committee and in the audience here. I want to not turn this into a one-on-one argument. So
Just asking.
if you wish to reply, Christie, go ahead.
Mr. Chairman, I'm using the term viability as the courts have used the term viability, and they have recognized that viability means being able to live on its own or outside of the womb. Thank you.
Thank you for the questions. Okay, if we got anybody left online, Amanda, who wishes to testify to this bill.
Mr. Chairman, Miss Vicky Swenson's in the room. She'll just need to turn on her mic and video.
We can't see her yet.
She's in the room, Mr. Chairman. She just needs to turn on her mic and video.
If you can hear us, go ahead and unmute yourself and turn on your video.
In the meantime, Mr. Chairman, she's the last one with her hand raised at the moment.
Very good. We'll give her a few more seconds. If she doesn't show up, we'll go back to the room here and give her a little bit. I'm not seeing her. Let's defer. Is there anyone else in the room here in person that wishes to testify to this bill? Not seeing any hands or anybody jump up. No success in getting our last online visitor. How about that phone call? Did they want to testify to this bill?
Mr. Chairman, I believe they've got off the call.
Okay.
Hello,
Morning.
Rebecca.
Okay, not seeing this person show up. I think we're gonna
Rebecca.
close public testimony.
Uh,
Oh. Heard a voice. I think we're gonna go ahead and close the public testimony in the interest of time. Anything you'd like to wrap up there, Representative, to give us last further bit of wisdom?
I just wanted to say, I think that last person trying to testify had some glitches with her phone. She was a person who had some experiences directly related to this. I will speak just briefly. I support this bill. Obviously, I brought it. The woman who was going to testify actually was told her child may have some type of an anomaly, wasn't growing. The referral trajectory that Wyoming Women's Group, or I don't remember the name of the group, goes through, I think, are questionable. This woman's child, even though didn't show any growth for several months and talking to several doctors, eventually a good doctor somewhere here in Wyoming helped her out. The child is healthy now. I support this bill. I think you guys are worthy of making the decision on your own. Thank you. I yield.
Thank you very much. Representative, committee, what would you like? What's your pleasure?
I'll move the bill.
Bill's moved by Senator McEwen. I just said it wrong again. It's only been like 4 weeks. Any comments, amendments, discussion on the bill, committee?
Question.
Calling the question on the bill. Mike, could you take roll, please?
House Bill 161, Senator Bouchard.
Aye.
Senator Furphy. Senator Hutchings.
Aye.
Senator McCune.
Aye.
Chairman Baldwin.
Aye.
House Bill 161, 5 ayes.
Thank you very much. At this time, normally we would let the presenter sit down and fade away. But in this case, Representative, you don't get to run away. You're next in line. I want to reiterate for the audience who's joined us late here in the room and on Zoom or internet, whatever we call that, virtual land. that we do, are we gonna do what I'm calling the rule of threes? Today's the rule of threes day. Each testimony will be limited to 3 minutes. With the exception of departments or agencies, if we have anybody to testify, and the presenter, of course. 3 minutes, we'll try to do 3 proponents, 3 opponents, and try to alternate again, depending on how many folks we have. With that in mind, the House Bill 162, Medical Treatment Opportunity Act is next in line. We're right on schedule. It's 8 a.m. Representative, go ahead, sir.
Thank you, Mr. Chairman, members of the committee. So we just heard House Bill 161, and the reason why it had a 1 in front of it was because it was the most important one. Now we're hearing 162, and it might be second in line, but I think it's equally as important because both have to do with health. The first one had to do with the health of a preborn child, fetus, human being, Homo sapiens sapien species. That's us. In this bill, I'm just going to speak from the heart because there's a couple of handouts. I think most people know where they may be on this. And the problem that we have in Wyoming, at least for about 10 years, is that we have a gap in medical opportunities. So the Medical Opportunities Act is really a Medicaid expansion bill. So I did reach across the aisle. I'm Republican to the Democratic Party and got some consensus there. And there are not 2 or 3 people, but probably thousands, according to the numbers of people that do not have the opportunity for that type of care. And I've said it in other committees, I'm one of them. I'm probably the first person elected to the House of Representatives who lives in dire poverty, but I do know how to take a shower and put on a tie, so no worries there. That's the problem. I think the fix has been made complicated by the American Care Act or the Obamacare Act. And just a little refresher, when we first got Obamacare to become law, there was, if anybody remembers, there was that 9 pro-life Democrats who held the bill up. They said, if you don't give us some assurances that no federal funds will be used to abortion, we're not going to sign this bill. At the last minute, President Barack Obama at the time signed the executive order that said no federal funds will be used towards abortion. He backtracked that 2 years later with the HHS mandate, giving a lot of heartburn to Medicaid expansion, basically how it would relate to states. When I came into the legislature, my first inkling was, how can I make a fix there? Is there a way I can prevent that through a CARE Act? And the second thing was, I sat down with the legislative service professionals, our staff, to try to create a medical bill that was Wyoming and that was Republican in nature, do it ourselves. And when I suggested let's do that, I remember the good attorney's pen dropped on his weight. I said, what's going on here? He said, the only problem is that's going to cost $2 billion and we're in a budget shortfall and we've been in one for a while. I said, not my problem. Do it anyway. Facetiously, maybe. I know we just can't pull $2 billion out of the air. I said, all right, well, let's bring up Medicaid expansion, give some opportunities, some medical opportunities to people that need it. And so that's what this bill is. I think it's not a silver bullet, but we give 2 years to ourselves as a legislative body to try to make it work. And if not, we pull out. And if that doesn't please the body, then we don't agree to it one way or the other. I digress. Thank you, Mr. Chairman.
Thank you much, Representative. And I have to profess to you that we appreciate you speaking from the heart. And we appreciate your testimony and what it means. We appreciate you being in the legislature. Welcome to the legislature, by the way. Okay, with that in mind, I'd like to hear from the departments first. Do we have somebody from the Department of Health? I don't see anyone in the room. Is there anybody on the internet from the Department of Health? Amanda?
Yes, Mr. Chairman, I just let Mr. Frank Buchan.
I suspected that would be who we would see first. Welcome, Franz, to committee.
Good morning, Mr. Chairman. Good morning, members of the Senate Labor. My name is Franz Fuchs. I'm a policy analyst at the Department of Health. I believe you all have received the reports that we've done on this topic. And I obviously don't want to risk any animal cruelty statutes violations by beating this dead horse any further. So I'm happy to just answer questions in those reports.
I think that was plagiarized from yesterday's session.
Yes, sir. It was a reference to Senator Riggs.
Yeah, I knew it. Well, there will be no fine. There's no penalty for that plagiarism. Committee, this is the gentleman who probably knows more about Medicaid expansion, about everything we're talking about here than anyone else in this room. If you have any questions about how the program works, or Senator Furphy, go ahead.
Thank you, Mr. Chairman. Let me ask you about, I have a copy of the report that the Department of Health did in February of this year regarding enrollment and cost projections. And one of the things that, looking at this report, that jumped out at me about is there's table 2 in there that says the largest Medicaid eligibility categories by enrollment. Obviously, the highest average enrollment was for low-income children, 33,526, which is significantly the highest category there. I would wish if you would comment on that. Thank you.
Go ahead, Franz.
Mr. Chairman, Senator Furphy, yes, that's currently our traditional Medicaid program that is largely made up of low-income kids. And that's a mix of, I believe the standard, varies by age, but it's around between 156% of poverty level. I think below 8. And I'm again speaking off the cuff here, so I can certainly get you a report on what those standards are. But we also now have kids that were formerly in the CHIP program, so that income standard goes up to 200%. So it does cover a variety of low-income kids. And as you can see, it makes up the largest fraction of our total Medicaid enrollment currently.
Okay, further questions, Senator Hutchins.
Thank you, Mr. Chairman. Mr. Franz, I spent a lot of time this weekend reading on Medicaid and looking at, I'm sorry, I'm trying to find your Wyoming Medicaid chart here, or your pamphlet. And I read that this weekend. And I had some concerns where I read several times about the charts and the graphs in there. It would say, well, these are just models. And this is what should happen, or this is what could happen. But you never really saw anything definite in the brochure you put out. Let me get you the name of it so you know exactly what I'm talking about. Just a second here. Just a million articles I read this weekend. The Medicaid expansion in Wyoming, enrollment and projection and cost projections. Can you tell me a little bit more about the model and why there's nothing really specific, but just kind of maybe this could kind of thing?
Go ahead, Franz.
So, Mr. Chairman, Senator Hutchins, yeah, it is a statistical model. So we don't obviously we haven't expanded Medicaid. We don't necessarily have a registry of all those people that would enroll. We have some estimates on the total population that's eligible based on census data. However, it's a voluntary program, so we don't know what fraction. The real variable we're looking at, we're uncertain about, is the fraction of that population that would actually take up and enroll in Medicaid. And so what we've done is we've looked at every state that's expanded Medicaid. And if you look at page 11 of that report, you'll see how the model sort of predicts or covers the actual expansion experience of all those expansion states. Wyoming, again, we're basically looking at state level predictors. So we're trying to look at the expansion states and say, okay, what factors are relevant in determining what that take-up rate might be? And so that ranges from the economic, the composition of the economy, what percent of people work in which sector, to percent of people on food stamps. We tried to find basically significant statistical predictors on the state level to try to estimate what that take-up parameter would be. If you look on that graph on page 11, you'll see a dashed line at the top of each of those graphs, and that is per census data, kind of what per the census information, what the number of eligibles potentially would be. And you can see in some cases the actual enrollment has exceeded that in states like Oregon. But at the end of the day, our model tries to account for a variety of factors as well as provide the uncertainty. So we're really looking at what's our belief? How do we allocate our sort of probability of the take-up rate? And you can see Wyoming's, there is a large range in this model. We're 90% sure that it's somewhere between 13,000 and around 38,000. And our expected value of that is at around 25,000 at the 2-year mark. So I don't know if that kind of explains where we're going, but at the end of the day, in the absence of a crystal ball, we have to rely on these kind of methods to try to predict what take-up will be.
Okay, thank you.
Further questions for Franz Committee? Senator Bouchard.
Thank you, Mr. Chairman. Franz, as I look at other states, I see they've implemented income tax to offset the situations that have happened as we cost shift and people jump off of Obamacare and move over to Medicaid. That it doesn't just expand the care, it expands the cost. I also see that states have put work programs in place where they have to have a standard to have a work. I mean, have we done papers just on that aspect of how states would have to, I think, do that first before even talking about expansion? Because that's what it seems to me all the other states have done that in all reactionary to what they've done. Some as early as 2015, I believe. You see them even now, even a hospital tax is what I see, trying to offset what's happening, because we're just so you understand where I'm going with this questioning, is we also see that as we've got down to a single insurance provider, and as we look at other pools and expanding, even in insurance, where there's a big negative that if we expand insurance coverage with other companies, we're going to pull people out of that Obamacare pool and cause those prices to go up on their premiums. So this looks to me like we're going in an area where other states have gone. What are we doing to look at those, address that? How are we going to pull money in?
Franz, response, go ahead.
Mr. Chairman, Senator Bouchard, a couple questions in there. I'll try to take them as I heard them. So first of all, looking at the interaction with the Obamacare market, you're absolutely correct. We tried to estimate the amount of what we call crowd out, which is people shifting from the Obamacare exchange to Medicaid. And that's all in that report we provided. There's obviously an impact on costs. There's an impact on rates. Medicaid pays providers lower rates in general than commercial insurance. So there's sort of an offset there. We did estimate, however, that providers would come out ahead on average, looking at the total impact of the previously uninsured people compared with the loss of revenue potentially from people getting crowded out on the exchange. However, evidence from other states does suggest that what you're doing is you're taking the lowest income people on the exchange who tend to have the most healthcare problems and thus the highest healthcare costs. So in some ways, Medicaid expansion acts as a bit of a high risk pool. You're shifting that risk to Medicaid. And so the premiums in other states have actually decreased on the exchange when this population is removed. So there's an effect there as well. With regard to paying for it and revenue, we have only estimated, again, our role is to estimate the cost, and we've estimated that cost at meeting that initial biennial appropriation of $20 million state general funds. Now, a bunch of states have come up with different ways to pay for that. With the passage of the American Rescue Plan, we put out just a one-pager, or I guess technically it's 2 pages. And what that does is provide a temporary 8-quarter incentive for states to expand. And it basically gives states a 5 percentage point increase on their federal match for traditional Medicaid. And if that's taken into account, that changes the equation a little bit for those first 2 years. At this point, it would bring in an estimated $54 million of offsets to general funds. And because the Medicaid expansion would cost $20 million, that would net $34 million for the state in those 2 years. Obviously, if that match were to go away, the state would still be, and the state would choose to retain its Medicaid expansion, would have to find some way to pay for that $20 million going forward. And the reason we don't estimate beyond 8 quarters, this 24-month period in this report is just because the uncertainty is relatively large on the enrollment. We would want to see what enrollment is, before we make any projections beyond that time frame, if that makes sense. But you certainly could take the last couple months of that, estimate about $9 million total medical costs, per month for that expansion population on average, and project out. We can certainly do that. But at the end of the day, there's just too much uncertainty in the enrollment projection to really say what the costs and revenue would be beyond the 8-quarter period. So that's the reason the report is restricted to that time period. Did that answer most of your questions, sir?
Follow up, Senator Bouchard.
Thank you, Mr. Chairman. I think you answered a lot of the things that I knew already, but I'm talking about, why are we not looking at if we did work programs and what tax structures, things that, I want real numbers. I want to know, how would we do it beyond? And so that's what we're not looking at. We see the other states that they expanded and now they're kind of in trouble. And I think Montana has a tax structure in place, an income tax that they've, if you're going to be enrolled, even if you're enrolled in this, you have to pay for it. So we're not even looking at that. We're not even there. Why would we even look at all these numbers of doing this and not look at what other states are already doing, because they're in trouble? So that's kind of where I'm going.
Franz, you may be limited in what you may be able to answer. Go ahead and reply.
Mr. Chairman, Senator Bouchard, I can only talk to the work requirements piece. A lot of states have looked to implement those with respect to the expansion population. However, this current administration is not amenable to those kind of requests and is in fact actively going to roll back work requirements in other states. So we do not see that as a viable option for Medicaid expansion, just because we don't believe CMS would allow that at this point. With regard to revenue and paying for it, at the end of the day, our role as the Department of Health is really to tell you, what our projection for enrollment is and how much it might cost, as well as, other sort of specific health-related programs like this 5% bump that we can certainly calculate based on our existing Medicaid expenditures. How this is paid for going forward, again, that's a really wide topic that you can go in a lot of different directions, whether it's a hospital tax. So I've heard some states, I think Montana was thinking of a tobacco tax initially. There's a variety of ways to pay for it. I think that would be up to your revenue committee, sir. It would certainly be out of our Department of Health's expertise to talk about those revenue raising measures.
Chairman Baldwin, I will note, this is Jesse Springer from the Department of Health. Hi.
Go ahead.
I will note that in the early versions of Medicaid expansion studies, we did note possible ways that all or part of Medicaid expansion could be funded within existing expenditures. I think that possibly may have changed with 3 or 4 rounds of budget cuts, but there were existing expenditures that do get offset. There's examples. There's all sorts of medical care that's provided by the Department of Health and other agencies to this same population that you would not be spending anymore. And so what you're coming up with is the 10%. And so in some cases, those are 100% general funds, and those studies have exist. I think we just haven't continued to include those type of calculations for a variety of reasons. But so some states have done that. It's basically self-funded from existing expenditures. And then other states have voluntarily implemented taxes on themselves. So where you have, when you're talking about a hospital tax, the hospital is actually making money from a Medicaid expansion, so it chooses to implement a 1% tax on itself because the math of that is that it comes out ahead with Medicaid expansion. So when we're talking about provider taxes, usually and adding expenditures in almost every state, I'm not aware of any example that a provider tax, the provider actually came out behind with the implementation of those type of things. But I don't think that's even proposed here. So.
Senator McEwen, go ahead.
Thank you, Mr. Chairman. I really got to applaud everybody's effort on marketing this plan. It's fantastic. I've heard stuff like we're leaving money on the table, how wonderful this is. The truth of the matter is, in 2008, I, as a business owner, was capable of providing insurance to my employees. And then we interjected the federal government. So what I was doing is now illegal. And we took that burden away from me, and I should be happy. But the truth of the matter is, most of them ended up unemployed or uninsured, excuse me. Following that, now we're going to interject more federal government, create more socialized medicine. And it's like the Hotel California. We can check in anytime we want, but we can never leave. And everybody says we can. So we're going to insure 28,000 people, 25,000, 24,000 for 2 years. Federal money dries up and we're just going to say, sorry. The other thing is, of that 25,000 or 24,000 people, over 23,500 and some of them are already eligible for Obamacare. So I guess my question is, and I heard Franz say it earlier, oh, they're going to switch from Obamacare to Medicaid expansion? It's already there. So I really want to know why we really think this is a good idea and what we're really going to gain other than put the United States of America $31 trillion in debt.
Reply, Franz or Jesse, either one who wishes to.
Mr. Chairman, yeah, just a couple questions in there that we can try to field. Obviously, the crowd out is an issue that really refers to people between 100% and 138% of the poverty level that may already be eligible or are already eligible for those insurance plans. That's about a third of the potential eligibles. So there is a group of folks. It should be noted that between 0 and 100% of poverty who are not eligible for those subsidies, and that's those would be people that obviously can't get insurance now, and there are a significant fraction of that group of people is currently uninsured. So it's not the crowd out is not necessarily 100%. I think the second point is that of the people between 100 and 138% of poverty on the exchange, those are heavily subsidized plans, almost the level of Medicaid, where the cost sharing is very minimal. Their premiums are subsidized to the point where they're paying very little out of pocket, and those are federal dollars too. So in some ways, there's a substitution of federal dollars for federal dollars when you're looking at switching from Obamacare to Medicaid. Mr. Chairman, did that answer, Senator McEwen, did that answer your question, sir?
Yes, you did. Thank you very much. One follow-up question, Senator McEwen.
Mr. Chairman, it doesn't take much effort to get to 100% on the poverty level. If you look at that, that's a $7.25 an hour job. And you just stated that the federal government is pushing back on that. We don't want to make people go to work. We just want to give them health care. It just runs counter. We're just building more and more dependency. So my question is, are you aware of what it requires to be 100% at the 100% level of poverty?
Franz or Jesse?
Mr. Chairman, so the federal poverty level, you can Google those, the poverty guidelines. For 100% of poverty in 2021 is $12,880 annual income for a single person. But it's important to note that as your household size increases, that threshold does go up. So for example, with 3 people in the family, that's $21,960. For 5 people, it's $31,000. So I certainly can see how, you know, a minimum wage job would for a single person would get you at 200% of the poverty level, or approximately there. It just, I think the issue becomes, you know, for households with kids, you know, for families where you have a single wage earner, that then it becomes a higher threshold income.
Chairman Baldwin, I would like to note that a significant part of this population is employed. So I think Franz has noted that in his study, but I think previous estimates are 60 to 70% of the population is employed. Some estimates are higher than that. They're partially employed. They can only find a certain amount of hours to work. Some of these people may have undiagnosed disabilities or only be able to work a certain amount of hours. They may not meet the SSI standard for disability. I mean, there's a lot of scenarios here that people are not earning that standard. If they're in a large family, they may not. Your income actually has to get relatively high to hit that 100% standard, but you're still held against it. So there's a lot of scenarios here where there are a lot of people working. They're just working at, you know, relatively low wage jobs, or not getting, you know, 40 hours at those jobs, or a mix of both. So I just hope we know that most of these people are working.
Thank you. Senator Hutchins.
Thank you, Mr. Chairman. Either one of you can answer this question. On page 23 at the very bottom in one of the footnotes, just a casual comment there about while the federal government has stopped paying insurers costs. My thoughts here are, while the federal government stops. And my concern on the bill on page 2, we have lines 12 through 18. We have a stipulation here. Any expansion of Medicaid program under this section shall not be administered during any time in which the increased federal medical assistance percentage is less than 90%, nor shall the program be administered during any time in which the regular federal medical assistance percentage is less than 50%. So seeing this and knowing that the federal government can stop at any time paying, and from what I've seen in my readings this weekend, they're not paying 90%. I hear 38% and so on and so forth. So like I say, the concern is the federal government can stop. Does this program stop? When I look at the US debt clock, which I send a lot of people to that have been emailing me, we're not at 30 trillion. The US debt is $85 trillion of unfunded mandates. And that clock is spinning like a wind turbine in our Wyoming winds. It's not just a slow tick. It is flying off the hook. So for me, my concern is, and I ask this question all the time, and I'm waiting for someone to answer it, where are we gonna get the money to fund this program? even in our state, we're asking people to cut back over and over and over. And we're now saying, no, let's jump on this program where the federal government is gonna promise us all this money for 2 years. What's gonna happen on year 3? We're gonna be back where we started. And I'm just afraid for our nation. Thomas Jefferson said, debt is the most fearful thing we're to get into. And we're not only trying to run into it, we're sprinting into debt. So with that, how are we gonna pay for this program? Because it seems like the state can pay so much. And then what I've seen in my readings, I know I'm asking a lot of questions, is that the federal government will jump in with no cap and pay the rest. How's that gonna be done? When I'm serving people at a party, when my pots are empty, there's nothing else I can give them. So how are we gonna do this?
There's a couple of questions there for you guys. Go
lot.
ahead, Franz.
Mr. Chairman, Senator Hutchings, you're correct. The federal funds are a combination of general revenues and debt, which has come from debt and income taxes primarily from the federal side. Unlike Medicare, which has some payroll tax and premiums built in, although there is of course general revenue there too. Medicaid is basically funded through general revenue. So you're absolutely correct. I mean, the debt is certainly a concern for, I think, all Americans. Again, I can't argue macroeconomics with you on the sustainability of that debt long term, or the ability of the federal government to pay it, to continue paying this its match. I would suspect that the federal government is good for at least the next 8 quarters on this. But again, yeah, it's certainly a philosophical question that is certainly in your hands to decide. With regard to the footnote that you mentioned on page 23, I can probably be a little more helpful there. The cost sharing reduction subsidies, the federal that was an executive order by the Trump administration. So obviously it was not in statute that the feds had to pay those specifically, or they wouldn't have been able to do that through executive order. Again, it's kind of an interesting footnote to the ACA, but insurers responded by basically in Wyoming anyway, by raising the premiums on the silver level plans. And this gets again into the weeds of things. But I think there's a difference there between the cost sharing reduction subsidy requirement and the federal match. Federal match is set in the Social Security Act. All this was amended in statute. It's not up to at least the executive branch of the federal government to decide to stop paying match on Medicaid, if that makes sense.
Chairman Baldwin, to a few other items in the question there. The 50% current match rate is in the original Medicaid statute from the 1960s, and it hasn't been changed since then. So that's the base rate. The 90% is in the Affordable Care Act. So for them to lower that would need to be a repeal of the Affordable Care Act, and you can get into the likelihood of that yourself, but that 90% is in the Affordable Care Act in the statute itself. The 55%, so the 5% add-on within this bill is in the American Rescue Act, which was recently passed this winter. And so that has the 2-year, 8-quarter funding in it. And so it would be, at this point, it is, written as a temporary incentive. I think we've, Mr. Fuchs has actually done the calculations of what that dollar amount is. What you do with that dollar amount, I think, is the legislature's choice. You could save that money and pay for 5 or 6 years of Medicaid expansion. You could spend it for current expenditures. But I think, to be specific, all of these match rates have a basis in statute. And so when we say that the federal government backs out of a match rate, that is, well, which hasn't really happened. But if it does happen, it means that a federal statute is changed.
Thank you for the questions, committee. No questions. Thank you very much, Franz and Jesse. I don't believe there's any other, are there any other department folks here from agencies or departments, Amanda?
Mr. Chairman, I don't believe so.
Okay, what we're going to do is we're going to do opposite of what we did last time. We're going to make the people in the room wait for a few minutes. We're going to go to the internet first. If I could, if we can have people raise their hands who are supporters of the bill, proponents, if we can let 3 of those folks in. And I would remind everyone for testimony, there's 3-minute time allotment. And we'll remind you when you get to the end of that nicely, not forcefully. So let's go ahead and let 3 supporters in the room.
Mr. Chairman, I currently have 15 with their hand raised. So what I'm going to do is I'm going to lower everyone's hand, and then those that you just requested, if they raise their hand again.
Great. You're the boss, Amanda. You give me some supporters and we'll listen to those 3 first.
Mr. Chairman, I've let in 3 out of the 12.
Okay. And there again, and I apologize, I believe it says Mr. Ward. Is that correct, committee? Can anybody else read that?
Raymond Ward.
Mr. Ward. Go ahead, Mr. Ward. Raymond Moore. Go ahead and introduce yourself and present to the committee, please.
Thank you. Thank you, Chairman Baldwin, and thank you, committee. My name is Ray Ward. I'm a primary care doctor in private practice in Bountiful, Utah, and I'm a Republican member of the Utah House of Representatives. So I've kind of had an opportunity to live through Utah's Medicaid expansion, seeing what happened at the policy level and at the state budget level, but also at a personal level. I want to just tell you about a patient and why this topic's important to me. 12 years ago, when we were just in our big last economic crash, I had a patient, Emily Young was her name, in her early 40s in my practice. And as the economy went bad, she lost her job as an accountant at a small firm, tried to buy Cobra for a couple months. And unfortunately for her, right at that time, she got breast cancer. And she had insurance at her job, so got the cancer taken out. And the surgeon said to her, well, we think we got it all, but we don't know that for sure. We would really recommend that you get chemo because we don't know for sure if we got it all out. But she couldn't afford the Cobra, and she had 2 elderly parents that needed to be taken care of at the time. So she said, well, for now, I just don't have a way to get that insurance. So I'm going to trust you that you got it all. And she didn't have coverage. And 3 years later, it turned out that they hadn't got it all. And that cancer came back, unfortunately, and killed her in her mid-40s. And that might have gone differently had she been able to have coverage at the time. As you may know, committee, there is some state money that has to be put into it. And in Utah, a ballot initiative passed, and the legislature then found that that wasn't quite right and made some other changes to it to put the program on a good financial footing going into the future. But I would say overall, it's gone very well for us here in Utah since we've had it in place. It's done what we intended to do. The people in the gap who did not have coverage, they have coverage and can get their basic healthcare needs covered. We have not lost any of our rural hospitals, and having Medicaid expansion in place is one of the important things that keeps them fiscally sound and able to provide services to people who are in a difficult part of the country to get services. When our bill passed, we had a backup plan in place. So in case there wasn't enough money, we said, well, we will go back with an assessment on the hospitals. If there isn't enough money there, and we have not had to put that backup plan in place, that is still waiting if things change so that more funding is needed, that we could change that assessment on the hospitals. Overall, if you look around the country, 38 states have decided to expand their Medicaid program. And we can think about whether it's gone well for them or poorly for them. But I would say all 38, when they looked at the benefit it gave to their constituents, to their citizens who lived there, and they looked at the cost that it cost them from their budget, all 38 of them have said, this is worth it. We're going to keep doing this. None of them have taken it back. Just on a personal level here in my clinic, I'm a private clinic. I'm not a charity care clinic. So most of the folks that I see have insurance and jobs, and that's how they have their insurance. But I probably see 3 or 4 a week who have Medicaid because of the Medicaid expansion, who would not have coverage if it was not for that Medicaid expansion. I treat folks in my clinic who have problems with opiate addiction. So some of those folks that I see are folks that are recently out of jail. So they haven't had income there and they have a problem with opiates. But because they have their Medicaid coverage, they are on their medication assisted treatment. They're taking their medicines. They're showing up to their visits. And that's one of the great parts of my job. I see this guy come in. He's 3 months out of jail. He's 6 months out of jail. He has a job. He has a girlfriend. Things are looking up because he has what he needs, and that ability to get that medication assisted treatment is one of the things that's keeping him out of jail and doing well. And he's grateful for that. So I guess in summary, from my 2 viewpoints, one for the state overall, I feel like it's going well. On a personal, just clinical level, my patients walking in my door to my clinic, to them, it looks like it's doing well. And I hope you'll support the bill, because I expect it would go well for the folks in Wyoming just the same. And I'd be happy to answer any questions.
Thank you very much. Questions, committee? Senator Bouchard, go ahead.
Thank you, Mr. Chairman. My question kind of is based off of, it's not apples to apples with Utah and Wyoming. You have an income tax in Wyoming and we don't. So one of the things that I'm looking at here, as opposed to other states that have done the expansion, they actually started implementing a separate tax because they had to put it on top of their income tax. So that's another twist. We don't even have an income tax here now. So as we expand, we're expanding, people are going to jump in the program. Are you suggesting that we should just do this blindly without an income tax? I mean, how do we do this and know that we're not making a bad decision in 2 years where we're going to come back and tax people?
Dr. Ward.
Yeah, so the tax that was passed initially on the ballot here in Utah, which is still how the state's portion is funded, was from a sales tax increase. We have both a sales tax and an income tax, and so that it came from sales tax. But as has been mentioned, our backup plan, which would be an additional assessment on the hospital if needed, that has not needed to be put in place. And I have a belief that the economic arguments that if you allow people the health they need to work, and so they can work and pay their income tax, that also brings money to the state in revenue. And that dollar doesn't come in with a tag on it that says this dollar only came to the state because the person was healthy enough to work. So you can't always track that as easy as we wish we could through our fiscal analysts. But I do just fundamentally believe when people are healthy enough to work and they want to work, has been my experience, then the economy goes better for the state. And then there's a little more tax money that comes in and that helps to cover the program. And I do believe we've seen that so far here in Utah. So when 90% of the cost is being covered through income taxes that we have already paid to the federal government, we're just getting our fair share back, as 38 other states are already doing, as we've done here in Utah. So the state does have to pay 10% of the cost, but I believe there's a way that it can and has worked out. And I think that's why those other states have continued the program in place.
Follow-up question, Senator Bouchard.
Thank you, Chairman. Again, we don't have an income tax in Wyoming. So in Utah, you're able to fund government through that income tax.
Well, ours was a sales tax.
Further questions, committee? Senator Hutchins.
Thank you, Mr. Chairman. Representative Ward, you stated that you're receiving money from the federal government that you put in via federal taxes. The revenue that the United States government receives from the federal taxes is at $3 trillion. The unfunded debt is 85 trillion. How do you feel that that's fair, that you're getting more money from the federal government than anybody is actually putting in with all 50 states?
Well, I mean, all of our citizens in all of our states pay some taxes, and then we get that money back. And then if the federal government borrows, then we need to figure out a way to pay that back in the future. And that is certainly the case. I think if some states choose to not participate and not get their fair share of their money back, I'm not sure that, to me here in Utah, I'm glad that we're getting it back. I think I think our folks benefit enough that we here in the state benefit. I'm happy we enacted the program.
Follow up, Senator Hutchins.
Just so I can make sure I'm hearing this correctly, if 50 states are putting in 3 trillion plus, but they're taking out 85 trillion, how is it your fair share?
Well, the 3 trillion is yearly, and the 85 trillion is a single one-time number. And I think, I'm not sure where that number is coming from. I mean, the total debt right now is around 20 trillion, where 3 trillion is the yearly amount that's put in. I mean, those are difficult numbers to balance out. All I can tell you is I think the program's working good and our folks are doing well because of it.
Thank you, Doctor. Further questions? We lost Senator Bouchard. No further follow-up. Thank you very much for your presentation. Thank you much for your medical work and your work in the legislature.
Thank you.
Thank you very much. The next presenter, I believe, is Danielle, and I apologize, I can't read your last name, Danielle. If you would introduce yourself, and we'll start your 3-minute timer, ma'am.
Good morning, Chairman and committee members. My name is Danielle Arno. I'm zooming in from Sheridan County. I'm just, this has been quite a morning. I am here to testify personally about why I want Medicaid expansion. And I can tell you that in 2016, I moved back here to Wyoming because I am a homeowner, born and raised here. I came back after graduate school thinking that I would have a meaningful job and be able to raise my child here. I am a single mother. Got back and couldn't get a good job. I was working menial jobs, barely making ends meet, barely making my mortgage. Finally, after a few years of struggling, I decided to start my own business, my cleaning business, with my master's degree in public administration, with dreams of hopefully being on the floor where you all are. I started my own business, and a few months later, COVID hit. I must say that before this, because of my low income status, my son was on Medicaid. Thank goodness. He wouldn't have any dental appointments or any kind of medical attention without that. Once COVID hit and we were home for that few months, I became very depressed and just really struggled. Wasn't sure if I was going to make it through that time. Was talking to my child support folks that helped me with that work for the state, and they suggested that I try to get on Medicaid so that I could get some mental health and medical attention. I was able to do that. I applied, and because of the CARES Act, I was able to get on Medicaid myself. Thank God. I got right into a doctor and got some antidepressants. Never ever had depression before in my life, and I was able to get well. If I wouldn't have been able to get Medicaid, I don't know that I would be here testifying right now. I am able-bodied. I work hard. I have a master's level education, and I truly resent the fact when I hear people talk about how if I have Medicaid, it's going to cause me to be dependent. I really am disappointed that anyone would think that that is true. I'm sure that there is a small number of people who take advantage of programs like that. But I tell you, I work every day. I have a son. I'm barely making ends meet. I find that when people talk about theories about debt and what we're going to do, I really get upset because I feel like, this is our lives. We live in the wealthiest country in the world, and I have to beg to get some kind of health care. And even before COVID, I was making $12,000. So please explain to me how I'm a well-educated person. I've got 15 years of professional experience behind me. I'm a homeowner. I mean, I'd like to hear some members, talk to me about where they think my failings are that I need to be dependent on government programs, because I'm willing to hear what your ideas are, because I'm out here and I'm doing the deal. So
Get you to
is
wrap it
that
up
my
in
3
about 30
minutes?
Seconds. We'll give you
Oh,
30 seconds. to wrap it
sorry.
up. Fine, you're fine.
Yeah, I think that's probably all I have. I just know I'm doing the best I can, and I'm low income, highly educated, homeowner, American Indian. So I guess that's probably all I can add right now. If anybody has any questions or comments.
Thank you. Questions, committee? No questions. Thank you very much for your testimony this morning. We appreciate you being with us. Okay, Amanda, was there another one out there? One more. We'll hear from somebody who's a supporter of the bill.
Mr. Chairman, if Adrian turns on, there he is.
Yep.
Adrian,
Hi,
welcome to Health. Go ahead and introduce yourself and go ahead and give us your testimony. 3-minute clock's running.
Okay, thank you for having me. I'm Adrian Garretts. I'm the chairman of the Campbell County Memorial Hospital District Trustees in Gillette, Wyoming. And I'm just here because from the hospital perspective, rural hospitals across America are closing down at an alarming rate. And what we all want out of government is efficiency, right? And really, if you think that these folks that are not getting on Medicaid right now and are uninsured are not getting care, you're sorely mistaken. They, the central point for healthcare in a community is the hospital, and generally where we see these folks is in the emergency room. And a lot of them come because it's the only place they can get care when they don't have insurance and they don't have the ability to pay. And so, if you feel like Medicaid, we're basically trying to shift this cost to the state level, and I don't envy you that position, and I don't expect you to take that lightly, but I do just want you to know that these people are receiving care. It's just in the most inefficient way possible, because they end up in our emergency room seeking care for things that should be taken care of by a primary care physician if they had Medicaid, and we're able to see some in the community or even our physicians. And the way we see that at the community level is we have, $25 million a year in bad debt and charity care that we write off. And it seems to get worse every year. And as our mill levy declines, 10 years ago, it used to cover that amount. And now we get about 11 million in mill, and we write off about 25 million. And I'm not saying it's going to, take away all that bad debt, but it certainly does. It would help our bottom line to get these folks that end up in our emergency room seeking primary care, back into the clinics and on a program where they can stay healthy. And that's all I really wanted to say. I think Mr. Boley can give you some more information on that. And to be clear, I'm not here speaking for the Board of Trustees. I'm just speaking for myself as a trustee.
Thank you very much, Mr. Garretts. Questions, committee. Senator Hutchins.
Thank you, Mr. Chairman. Mr. Adrian, a few weeks ago, we had another bill come before us, and we had the Wyoming Community Health Centers come in, and they were seeking assistance as well. And they boasted about caring for the vulnerable populations, savings to the system, economic stimulus, state-of-the-art practices, integrated care, managing chronic conditions, preventative care, and quality health outcomes. We saw an economic stimulus and jobs, and there was a boast of 64 million in economic impact, savings to the system, care for the vulnerable population at 39,000, or should I say 40,000. And they talked about 124,000 patient visits. And the integrated care include for that 36,000 medical care, dental care, behavioral health care, vision care, and some mobile care. And the program sounded awesome. They managed chronic conditions such as asthma, diabetes, hypertension, and they offered preventative care. And I just thought that was awesome. And I'm wondering, they said there were about 39 around the state. What's going on with these community health centers that people aren't going there for their care? And is it the fault of a hospital that they're opening up their doors and not saying, hey, you know, you got the community health care, why don't you step over there first for some of your symptoms? Can you help me with that?
Sure. I can't speak to those community health centers. I don't believe we have one in Campbell County that I know of. So we're bound as a hospital by the EMTALA Act. I don't remember what year that was enacted, but it basically says anybody that comes to our emergency room cannot be turned away, and we must stabilize and treat them. So we even have to be careful with our walk-in clinic, and our emergency care or our emergency department have to be two separate areas of the hospital, and we have to allow the patient to choose which one they want to. Obviously, we would prefer they go to the walk-in clinic to receive the care, but we as a Medicare certified emergency department have to allow those folks into our emergency department regardless of condition, and stabilize them. So I guess I don't have the knowledge to speak about the community care centers. And for sure, we'd like to move to a model of community health where we take care of all of these social determinants of health to try to keep these folks from having to come to the ER in the first place. But I guess I'm not in a place to speak intelligently about the community health centers. I just know what we see at our hospital.
Thank you, sir.
Thank you. Further questions? No further questions. Thank you very much for coming and visiting us today, Mr. Gertz.
Yeah, thanks for having me.
Okay, Amanda, let's move to three opponents, the three people who oppose the bill. If we have them, those people can put their hands down, and then three opponents put their hands up. I see the first one coming up on screen. And he just shook his head yes. So, sir, if you can introduce yourself, and I can't read your name from where I'm at. Go ahead and introduce yourself and go ahead and address the committee.
That's okay. Can you hear me all right?
We can hear you perfect, sir. Go ahead.
Excellent. Hayden DuBois, visiting fellow with the Opportunity Solutions Project, a nonprofit organization that looks at healthcare, workforce, and welfare solutions throughout the country. Thank you for letting me testify, Mr. Chairman and members of the committee. Just want to briefly go through some experiences with respect to Medicaid. I know there was some talk with respect to Utah and how it has allegedly been a success because it hasn't been repealed. I just want to point out that once you expand Medicaid, you can't take it back. Despite private assurances, it becomes a mandatory coverage group under federal code. It's not something that can be thrown out or taken away. In fact, Utah tried to limit it with work requirements that were suspended by the feds and limitations on program coverage, which I think is an indicator that it wasn't the rosy success that proponents would say it would. In fact, we only need to look to Montana. When Montana expanded just before, they were spending about 17% of their budget on Medicaid. 3 years later, 26%, more than $1 in every $4 was going to Medicaid. Enrollment, they were assured it would cap out at 59,000. Today it's at 97,000, and it was well above 59,000 before COVID, so that's not due to COVID. 65% increase in spending on Medicaid between 2015 and 2018 alone in the state of Montana. There was a recent study post-expansion by Navigant that looked at the state of rural hospitals in the country, and Montana led the nation as it relates to the financial instability of critical access rural hospitals after it expanded, which I think is a sign that this is no silver bullet for expansion. All while there was a 34% increase in the home-based and community services waiting list for the truly needy folks in Montana with developmental disabilities, intellectual disabilities, or who are aged or have severe mental health problems. Similar situation would occur in Wyoming. We estimate that based on the experiences of other states, not projections, but actual experiences, it would cost the $27 million a year just to the state alone to sign up about 42,000 able-bodied working age adults. In addition, I would add that a significant number of these folks do have private insurance right now, and a new federal COVID bill would actually provide private insurance to those between 100 and 138% of the poverty level, which is a portion of this Medicaid population. And it would provide it for free, entirely paid for by the feds. So the choice is allow those folks to stay on the new federal private insurance at a higher reimbursement rate, or move them on a Medicaid with the state of Wyoming chipping in. I think the solution is pretty clear. Briefly on hospitals, I want to point out that while there was some talk that, well, there's all these uncompensated care costs from hospitals that occur right now. Well, the problem is when you expand Medicaid, you might see a slight reduction in uncompensated care costs, but that is more than offset by a decline in reimbursement rates, because you have all these folks who were previously on private insurance, maybe through their employer sees they qualify for Medicaid, they remove them from private insurance, they go on to Medicaid, and now you have people going to the hospital at much, much, much lower reimbursement rates for providers. It's what we saw in Montana when there was a reported, I think it was a 21% increase in payers with Medicaid, while 30% decline in payers on private insurance at Montana hospitals. We looked at studies from all across the country in expansion states. Revenues for hospitals went up by 42%, but the cost to treat Medicaid patients went up by 50%, more than offsetting it. So at the end of the day, we estimate this would cost thank you, $16.3 million in new net costs for Wyoming hospitals. And I would just add, my final point here is, there's no going back. Once you expand, this is permanent. There is a federal incentive that would temporarily improve the FMAP for the traditional population. It lasts 8 quarters. Even though there's a provision in the bill that says once you're out, Wyoming can back out of the deal, they can't. Biden won't even allow modest work requirements. He's not going to allow the throwing out of an entire coverage group. It won't happen. So with that, I would be more than happy to take any questions from the committee.
Questions for Hayden Committee? Senator Hutchins, go ahead.
Thank you, Mr. Chairman. I know you oppose this program, Mr. Hayden, but in your research, how is the federal government going to continue to pay for this program? Thank you.
Well, go ahead. Good question, Senator. I appreciate it. I think it's always important to remind, because there's a lot of conversation that, well, the feds pick up a majority of the cost. One thing I always point out, and I think it's important to point out in the context of Wyoming, is Wyoming residents are federal taxpayers too. So at the end of the day, this is going to be picked up a portion by the state and a portion by the feds. The federal government is going to have to raise taxes or increase the national debt to continue financing Medicaid expansion. There's no magic pot of money sitting somewhere waiting for Wyoming to expand. And at the end of the day, this is going to be borne by our children, our grandchildren, who are going to have to pay more out of their own pocket in the long run. It's unsustainable, and it is something that is going to increase costs for all Americans, including Wyoming residents.
Thank you very much. Further questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. I wonder, have you looked at anything? I mean, I know that the feds can't make us do anything, but they've always used money to coerce us. And I think there's even court cases on that. And I think that's, you spoke a little bit about how we won't be able to we can't take it back. So isn't that all tied into the equation there? Isn't it? Once we.
Yeah, that's an.
Address the chair, please.
That's an excellent. Sorry.
Go ahead, Hayden. Just.
Yeah, Mr. Chairman, sorry. No, I appreciate it. It's an excellent point, Mr. Chairman, and I would say 2 things. That's absolutely correct. there is this incentive, as the senator noted, with respect to the federal government trying to coerce through money. It lasts 8 quarters. Expansion is Hotel California. Once you check in, you can't check out. It is permanent. There's no reason not a single state has unexpanded. And it's not because of great success. Many states wish they would be able to, but you can't. Under federal code and in several court cases that have been decided before federal U.S. courts of appeals and district courts, it has been cited that this becomes a mandatory coverage group under U.S. code. Once you're in, you're in. And what we've seen lately is attempts by the states to impose modest work and community engagement requirements of even just 20 hours per week. And the Biden administration is pulling back on that. If Wyoming were to expand and then try to unexpand at some point, if some federal money went away, it would be inviting a lawsuit from the federal government because they would fight tooth and nail to show that this is a mandatory coverage group and not allow Wyoming to unexpand.
Thank you very much, sir. Further questions? Seeing none, thank you very much for your testimony this morning. I saw Mr. Allred earlier. Has he disappeared or is he still hanging around? There he is. Mr. Allred, welcome to Labor and Health. Go ahead, sir. Your 3-minute clock is ticking.
Thank you, Mr. Chairman. I'm speaking on and against this bill. As many others have stated, every state that has put this in, it's been a dismal financial problem for the state. This seems like every single year we bring this thing up and we talk about it. We have killed it year after year after year, and now we're doing it again. And I know previously when they talk about the estimates and they're talking 25 to 30,000 people coming on, they say really the more reality is that we're probably going to have 45,000 because a lot of these people will shift over. If you're on Obamacare and you can get Medicaid for free, then you're going to jump over. Some of the smaller businesses will cut theirs. You know, in just my extremely short adult life, I've seen a huge change in insurance over the years. When I was 18 years old, I had a comprehensive catastrophic health policy that cost me about $20 a year. It didn't pay for doctor's visits, medicine, but it did pay if I was hospitalized. As we go forward, I spent over 15 years with no insurance whatsoever. It was not brought by my business. I couldn't afford it. And during that time, my two boys were born, and I had to pay. Each of those cost me about $10,000. I didn't ask for the government to pay for it. I didn't ask you to pay for it. I paid for it. It took me a long time and a lot of payments, and I paid for it. Now we come to today, and people are, as we look at this Medicaid expansion, it's just merely socialized medicine. It's a step into that. And basically, I'm being asked to pay not only the $700 a month I pay for my insurance, but now I'm expected to pay for able-bodied people for their insurance. I don't think that's fair. I don't think, and raising taxes, we've heard several different things. People talking about maybe a provider tax that pays for some of that. Yeah, I mean, that's a Rube Goldberg machine. It doesn't work. You're going to say, oh, well, you're going to get more money because of Medicaid expansion, but out of that, we're going to take a tax. It's going to pay for it. I mean, come on. That's not going to work. We're going to have to raise taxes. Our state is already short on money, and the people cannot afford these taxes. If people are able-bodied, they can pay for their medical. Yeah, it's tough. It is. And I feel for some of these people. But to expand the government program that's going to bring a lot of problems with it, that's not the answer. We already have Medicaid for those who truly, truly need it. But to turn around and expand more. And some people say, well, we're leaving free money on the table. Seriously, can anybody operate a calculator? If the federal government pays 90%, we are still paying 10%. That's an increase of what we are paying right now. It's not a revenue bill. Just because you're bringing 90% from the federal government, 10% is still coming from us.
About 30 seconds to wrap up, Carl. Go ahead.
Yes. Well, go ahead. I could go on for a long time, Mr. Chairman, but I understand there's limits, so I'll stand for any questions.
Thank you very much. Questions for Mr. Allred Committee? Seeing none, thank you very much for coming to our committee this morning. Amanda, do we have one more opponent of the bill in the room?
Mr. Chairman, Miss Vicky Swenson is in the room. So if she just turns on her mic and her video.
And I see her name and I see her face. I hear her. Swenson, go ahead.
I think I'm okay. Good morning, Chairman Baldwin and committee members. I'm Vicki Swenson and I'm a retired elementary teacher and I've lived in Campbell County for 40 years. And thank you for the opportunity to speak this morning on behalf of this bill. Reduction in force and closing of our coal mines up here has deeply affected many families in Gillette. When mines layoffs or mine closings happen, the effect to a miner and their family can be devastating. Now, what do? And that is a ripple effect which spreads across the community. Miners may have less to spend and local businesses feel the effect. Our present economic downturn isn't going to last forever. But in the meantime, people need to be able to go to the doctor if they get sick or to the hospital if they get injured or have a health crisis. Not add tens of thousands of dollars in medical debt to their already mounting financial obligations. When a family or individual income gets too low, people simply will not have the dollars to pay for emergency care. And then we add to the already uncompensated costs, which hospitals must absorb and in turn forced to pass on to patients who are uninsured, which eventually could lead to insurance rates going up for everybody. Will people opt not to go to the doctor for preventive care? I'm afraid that will be the case. It is now for the vast majority of the uninsured. Without insurance, the dollars simply are not there. We have all heard of the devastating outcomes that preventive care could have prevented. Medicaid could have provided that preventative care, which could have well saved a life. Gillette is falling into hard times right now. People in our community are struggling. Having health insurance through Medicaid could be the difference between getting back on their feet or being buried in medical debt for years to come or forever. And ultimately, Medicaid coverage may well be the one thing that keeps people in our community. And losing families is a big concern to me and the community at large. Put yourself in the shoes of Gillette breadwinners. You have always provided insurance benefits for your family. Now you cannot. You have worked your whole adult life in well-paying jobs with insurance, or you had income to purchase your own. Now you do not. You have let your family down through no fault of your own. You have growing medical debt in which you may never get paid. For the first time in your adult life, you need a hand up. You need some help. Medicaid could very well be that helping hand. I ask you to please vote for this bill and help the thousands of people who have, contrary to what other testimony says, really have no other choice but Medicaid expansion. Thank you for your time.
Thank you very much, Ms. Swenson. Questions, committee? Seeing none, thank you very much. And we appreciate you visiting us all the way from Gillette. We appreciate the technology that makes that able and possible.
Thanks for having me. Thank you.
Thank you very much. How many do we have left to testify in the internet there, Amanda?
Mr. Chairman, we currently have 3 with their hand raised. I'm assuming that might go up.
Let's go ahead and do those 3 in. And then we're going to probably move in here to the room and let some of these folks testify.
Mr. Chairman, I let 3 in.
I see Mr. Laycock. Tom, why don't you go ahead since we can see you on the screen? Go ahead and introduce yourself, and your 3-minute clock is running, sir.
Thank you, Chairman Baldwin. Good morning, members of the committee. I'm Tom Laycock, Associate State Director for AARP Wyoming, which represents over 83,000 Wyomingites over the age of 50. I'm here today to express the support of AARP Wyoming for this bill. As you're well aware, Wyoming is one of only 12 states that have opted not to expand Medicaid, and expansion would allow Wyoming to get $9 back in funding for every $1 spent by the state. Right now, we're leaving approximately $1.3 billion of federal funding on the table over the next 10 years that could be flowing into our state's economy. These are taxes that we've already paid. It'd be great to bring that money back and to boost the Wyoming economy. Now, as I mentioned earlier, we represent those age 50 and over, and the Wyoming Department of Health's latest estimates as for who could benefit from Medicaid expansion show 1/3 of those newly eligible in Wyoming are between the ages of 50 and 64. Now, keep in mind, at 65, most Americans go on Medicare. Those numbers of those aged 50 and over who would be eligible for Medicaid in Wyoming really surprised us when we saw them last year, and continue to suggest Wyoming has a larger population of working poor over the age of 50 than maybe we realize. This has some implications for the state both now as well as further down the road. It's a reasonable assumption that this age group of working poor will not be able to save for retirement, afford nursing homes, and is more likely to require more state services, such as long-term care and low-income energy assistance later down the road. If you're not aware, and I'm sure I've said this about 1,000 times, so you probably are, Wyoming Medicaid, current Medicaid, pays for a nursing home level of care for those who have that nursing home level of care and a Medicaid level of finance. This is a 50-50 split between federal and state funds. Right now, Wyoming's Medicaid long-term care cost spend was $130 million in the state last year. The Department of Health projects that could reach over $300 million by 2030. It may be beneficial for Wyoming to help new Medicaid enrollees get chronic conditions under control using Medicaid Expansion's federal dollars at 90% before they're more likely to move into more costly long-term care and other state safety social net programs. Just something to consider. We encourage Wyoming lawmakers to carefully consider how this opportunity could positively impact older Wyomingites and their families, Wyoming healthcare providers and hospitals in rural areas, and the taxpayer. We stand ready to help in any way that we can, and I'd be happy to stand for any questions.
Questions, committee, for Mr. Laycock. Senator Bouchard.
Thank you, Mr. Chairman. Mr. Laycock, one of the biggest things that I see with elderly population that they say, yeah, we need this. And they find out that there's a serious financial implication to their property. One of the biggest search terms is, how do I hide money from Medicaid? And if you actually look at that online, you'll see, and I'm just looking at some of them right now, how to protect your assets from long-term care costs, 5 ways to protect your money from Medicaid. And there's basically what happens is they have to now put their property in a trust to hide it, because there's nothing free here. I mean, that's kind of what's happening. So, and we also know that there's some fraudulent things happening because of this. I mean, so how it comes back to the question: we're either going to have to raise taxes, or people are going to cheat. Something's happening here. I mean, and once we get stuck in this, we can't back out. So, and I guess what I really want you to do is focus on how the elderly are having to use these trusts to protect their property. So that's my main concern that I want you to address.
Go ahead, Mr. Laycock.
Mr. Chairman, Senator Bouchard, I'm not sure there was a specific question in that.
Any thoughts or anything you'd like to share with us about that, Mr. Laycock? Even if there wasn't a question.
Mr. Chairman, there is not. Thank you for the opportunity.
Okay. Further questions, committee? Okay, thank you very much, Mr. Laycock, for joining us today. Amanda, do we have one more who's going to join us?
We do, Mr. Chairman. Mr. John Mansell is in.
Okay.
If we can just get him to turn on his mic and his video, he's ready.
Mr. Mansell, are you with us? There he is. Welcome to.
Here we go.
Welcome. Welcome to
Thank
Labor.
you, sir.
You have 3
Thank you,
minutes.
Mr. Chairman. First, I have to issue a disclaimer. I'm speaking for myself personally and not for any organization on whose board of directors I may sit or for any employer. All doctors in Wyoming want to improve access and take care of our fellow Wyoming citizens, and the existing Medicaid program is critically important to serve those people in true need. But Medicaid expansion in other states has decreased access by increasing wait times for Medicaid recipients in the existing programs in these expansion states. And by expanding Medicaid will necessarily shrink resources for these people in critical need, most of whom have no other options for health care. Here in Gillette, there's several of us who've been practicing for over 30 years, and we get up in the morning and go to work because we love our jobs, not because we need the job anymore, and it's not about the income. And we still see Medicaid patients. But if we expand the number of Medicaid patients, we literally will not be able to keep our doors open. And this is an observation that's been shared to me by some of my other senior colleagues in Gillette. Medicaid simply doesn't pay enough to cover the cost of the care for the clinics or hospitals. And evidence of this is in the past year, we've broken a new record for rural hospital closures where 20 hospitals have closed in the US. Most of them were in expansion states. Medicaid accelerates the decrease of fiscal health of the hospitals. And in the first full year of expansion in Montana, hospital profit margins fell 40%. Why? Because there were an increased number of Medicaid patients, and they basically just ripped their profit margin down even further. Hospitals don't typically have a very good profit margin to begin with, and they're also vulnerable because they can't turn anyone away. Every day in Wyoming in our clinics, we see Medicaid patients from other states who fled California, Washington, Oregon, and even New York because they have Medicaid coverage in their state, but their healthcare infrastructure has broken under the weight of the increased volume of patients whose program doesn't pay enough to cover the cost of care. The current models for Wyoming expansion don't account for flight from these other states, where people in these other states are just going to move to Wyoming because the cost of living is lower as well. And while the anecdotes from the proponent witnesses today are heart-wrenching, the statistics are damning. In other industry sectors, you as legislators ask ranchers, miners, bankers, and energy executives for their expert advice. And I'm advising you as a physician who's been practicing for 30 years. 5 years from now, you will not be happy you expanded Medicaid. I would strongly advise you, in my oath, in my duty as a citizen of Wyoming, not to pursue this policy because I don't believe it'll be good for the long-term health of the state. The other reason is that most healthcare is so expensive is because since 1987, the federal government has been shoplifting healthcare by paying less than the cost of the healthcare, and so it's been dumped on the private sector. Expanding Medicaid just tips this over even worse, where the private sector will be stuck with more of the bill. If you don't think that Medicaid can be manipulated, realize this: in Wyoming, with unemployment rates from 5 to 7%, 38 to 40% of Wyoming babies are born on Medicaid. I'm sorry, but some of those people are manipulating the system for their own benefit.
30 seconds. Go ahead, finish up, wrap it up.
I'm grateful for your time and the committee's time, and would be happy to take any questions.
Very good. Committee questions, Senator Hutchins.
Thank you, Mr. Chairman. Dr. Mansell, is everyone that wants to be on Medicaid, are they eligible? And number two, do all doctors accept Medicaid patients?
Dr. Mansell, go ahead.
Thank you, Mr. Chairman. I'm not an expert in eligibility, and I'm afraid anything I say will be highly inaccurate. So, Senator Hutchins, I'm going to beg for your forgiveness and not answer your first question.
Thank you.
Your second question is, do all physicians accept Medicaid? No, they don't. And I can tell you several examples in other states where certain services are just not available to patients. In Florida, for example, Medicaid pays about $100 for tonsillectomy, so none of the ENT surgeons do tonsillectomies for Medicaid in Florida. In New Jersey, after paying their malpractice and the cost of billing, an anesthesiologist makes $23 an hour. It doesn't matter if they're doing open heart surgery, a liver transplant, or a Siamese twin separation. That's what they get before they pay taxes, is $23 an hour. So needless to say, coverage does not equal health care. As a Rotarian and a Boy Scout and a retired Army officer, I think it's my duty to try to help everyone I can. I still take Medicaid, but there will come a tipping point where we literally can't keep the doors open.
Thank you, Dr. Mansell. Further questions for Dr. Mansell? Seeing none, thank you very much for joining us this morning, Dr. Mansell.
Thank you, Mr. Chairman.
Now get back to work. I see you got your mask off. Okay, we're going to move into the room here for a little while. And how many do we have left online, Amanda?
Mr. Chairman, I've admitted Rosalind just with the other two, and then we have 5 others in the waiting room with their hand raised.
Okay, we're going to hold off on those for a few minutes. I want to get to the room because we're going to run short on time here pretty soon. Noting that committee and noting that testifiers, if you've heard it already, say ditto or say I agree with what somebody else said, but let's try to limit our time so we can get everybody in if we can. We've got at least one person sitting at the table. Anybody else wants to testify? Jump up in the chairs. Senator Rothfuss, would you like to share some words with us this morning?
Mr. Chairman, I'll just defer to the public testimony of the folks that have traveled.
Very good, thank you. Go ahead and introduce yourselves. Representative Clifford, who can we, okay, go ahead, sir.
Good morning, Chairman Baldwin and members of the committee. My name is Jordan Dresser and I'm the chairman of the Northern Rappel Business Council. I appreciate you considering HB 162 and thank you for allowing me to testify on behalf of this bill. The Northern Rappel Business Council supports HB 162, the Medical Treatment Opportunity Act, and we ask you to support this critical piece of legislation. The bottom line is extended Medicaid coverage would result in stronger and more efficient healthcare services for citizens of Wyoming, including members of the Northern Rappel tribe, which I'm a member of. As you know, Native Americans face wide disparities in health and healthcare services compared to non-Indians. Some of these disparities are in the areas such as chronic diseases, cancer, and diabetes. In fact, the average age of death for Native Americans in Wyoming is 56. So that's a statistic. Our health clinic, known as Wind River Cares, does a great job of providing as high quality of healthcare services as possible for our people. However, the Wind River Cares is funded by the historically underfunded Indian Health Service, which currently funds Wind River Cares at 35% at its need. That means that Wind River Cares must come up with the remaining 65% as its operating costs in order to provide much needed healthcare services to the Northern Rappel people. Expanded Medicaid in Wyoming would allow Wind River Cares to be reimbursed by Medicaid at 100% of the federal matching area percentage, also known as the FMAP. That means that when healthcare services provided by Wind River Cares, or even if Wind River Cares refers a tribal member to a provider off the reservation, 100% of the Medicaid cost is covered by the federal government without the state of Wyoming having to pay any of the matching amount for this service. This will lead to the increase of the access care for Northern Rappel tribal members, and ultimately expand the capacity of Wind River Cares to provide additional services for tribal members. When Medicaid was expanded in other states, the expansion led to increased access to healthcare for Native Americans and increased the revenue to IHS and tribally operated facilities. We have no doubt that the same will happen to Wyoming if HB 162 is signed into law. The COVID pandemic has caused us to consider all options as we work to protect our people, and Wind River was hit hard by COVID, very hard by COVID, and we experienced a lot of loss from that. The pandemic has increased the use of our medical facilities and services and shown us the importance of having high quality healthcare for our people. Now is the time to extend Medicaid coverage to more Wyoming citizens and pass HB 162 will result in a healthier Wyoming and for the indigenous people of the state. Again, I thank you for the opportunity to share the support of the Northern Rappel Business Council, and I strongly urge you to support HB 162. Thank you all for your time this morning.
Thank you very much, sir. We appreciate your testimony. Questions, committee? Senator Hutchins?
Mr. Chairman, can I just make a statement?
Well, if you can say, don't you think at the end to make a
Roger
question.
that, Roger that. Jordan, I think your mask is the most beautiful mask I've ever seen. Don't you guys think so? Thank you, Jordan. And I really do appreciate your testimony. You did a very good job. Thank you.
Thank you, I appreciate that.
Thank you very much. That was the most pathetic attempt at a question I've ever heard on this committee. Thank you very much for coming. Representative Clifford.
Thank you, Mr. Chairman, members of the committee. Thank you for allowing me the opportunity before we gavel in here to express my thoughts and my concerns. I am in support of this bill. I want to let you guys know, my father was proud, worked all his life, worked very hard, and then he had a back injury and could no longer work. I was on food stamps. Really hard thing to do. But at the same time, my parents instilled that I needed to go get an education and I needed to come back and help my people. And so I did that. And so I take offense when I hear people say that I was taking advantage of Medicaid. I didn't take advantage of Medicaid. It helped me get through grad school. I have a master's in public administration. I served our gaming enterprises on the reservation for over 13 plus years. I was in charge of training. And what I did with training was teach over 800 tribal residents who never really knew what it was like to have a job because systems were never designed for our participation nor our protection. But that didn't stop us from being perseverant or resilient. And so what I was able to do was teach my people, my employees, about budgeting, about having a job and getting up any hours of the night to go to work, because a lot of them just didn't have those role models, and to earn their keep. And then I also was fortunate enough, we were able to hire a full-time nurse because of our health disparities that Chairman Dresser shared with you all here. And that was the education of preventive medical attention before it got exacerbated, where my people were going to the ER and helping with the healthcare rising costs. That is detrimental to everybody. I was in human resources for 7.5 years. I oversaw our medical health insurance. When I graduated from the University of Wyoming in 2005, we were fully insured. And then we went self-insured. Bad choice because of our health disparities of heart disease, cancer, and diabetes. And so it raised our healthcare prices up. And so we went into the federal employee health benefit plan. But at the same time, we had the nurse. At the same time, I trained my managers, 26 of them, to educate themselves about medical care, to have a one-on-one discussion where I'm happy you're here, I'm happy you're at work, but at the same time, how are you doing? Because in order to have a job, you have to be a good health, premised on health and well-being. And so that worked hand in hand. And so if there was ever a time to extend Medicaid to the residents of Wyoming, the time is now. It is now. I have people dying. Over 7,500 of the residents on the Wind River Indian Reservation are uninsured. And so a job is important, but also is being healthy to work those jobs. And thank you. I'll stand for any questions.
Thank you very much, Representative. Questions, senators? One question, Senator Bouchard, go ahead.
Thank you, Mr. Chairman. Representative. Some of what you laid out is almost like the federal government has broken our system. And I mean, I look at the federal government involvement on reservations, and I think they botched that too. And that's where I'm going. It seems like every time they have their hands in it, they hurt us. And that's, I mean, I'm kind of reading in between the lines there, but you went from a point to where you had care to where you didn't have care. And that's where I'm going right now. I think we're going to break the system further. I mean, do you see any of that pattern that I'm talking about?
Representative Clifford.
Thank you, Chairman. Senator Bouchard. What I would say to that is we have treaties that were broken. And one of them was providing health care. And as you heard from Chairman Dresser, our need is not met. And I have people dying. And so I would urge you, we need this bill. We just do. People are dying. My people are dying. And so, yeah, that's all I would have to say to that.
Follow up.
Yeah, thank you, Mr. Chairman. Just to follow up, Representative. I understand. However, I'm looking at how we're just gonna keep breaking the system. So you can see my concern. I think you're right. Treaties are broken. And I think that we're gonna put a Band-Aid on a problem that's gonna turn into a bigger problem. So I would like to possibly in the future talk to you about the things that we can do maybe at the state level for just the reservation. I'm looking at how on the outside, where this is gonna go. And we're gonna raise taxes, we're gonna create an economic problem for our state, where we're not attractive for businesses to come here. So, I mean, is that a concern as well, where economic problems are gonna come when we raise taxes and jobs go away here?
Mr. Chairman.
Further comments, go
Senator
ahead.
Bouchard, we have an increase in our native people that are going to get educated and coming back and helping the reservation. And they have no problem paying their fair share of taxes to help our people, because premised on our values of Arapaho people, indigenous people, is to help others, particularly the lives and saving a life. Thank you.
Thank you, Representative and Chairman. We appreciate your testimonies today. Okay. Don't be shy in the audience. There's 3 chairs. Let's fill them. Let's keep this moving. Go ahead. We'll start my left to right, your right to left. Go ahead and introduce yourself and go ahead with your testimony.
Thank you, Mr. Chairman. I'm Jan Cartwright. I represent the Wyoming Primary Care Association. We work with the community health centers here in the state. I just wanted to quickly thank Senator Hutchings for the study that she did on the graphics that I shared about community health centers, but I need to clear the record on a couple of things. One is that the data that she shared that the health centers serve 39,000 people is for 8 health centers. The number that Chairman Wilson gave was for other safety net organizations as well. So I'm very proud of the work that the community health centers do, but they do that on federal funds. So those federal funds are okay, but these federal funds are not okay. With all due respect, I think that's a fair question. At its core, this effort is to give people health insurance. Health insurance is the most expensive in Wyoming. 90% of the people who purchase health insurance on the marketplace do so with federal subsidies. Again, I don't see anybody trying to take away those federal subsidies. I think that the idea that people can jump back and forth between the marketplace and Medicaid means that they leave income. They walk away from jobs to become eligible for Medicaid. So I think that this isn't a candy store. This is about health insurance. People want health insurance so that they can take care of themselves and their families. Wyoming receives more federal subsidies than any other state. But now we're going to draw the line on people who are poor. That's where we're going to say that we don't want to take federal money. Right now, all of us are paying the cost of care for people who cannot pay for it themselves through higher insurance costs and higher hospital costs. This is not an Eagle song. It takes a state plan amendment to expand Medicaid. If the state decides that's not working, it takes a state plan amendment to get back out again. Wyoming Medicaid does state plan amendments all the time. The issue of maintenance of effort is a non-starter. It was 10 years ago and it is now. As a society, we're just recovering from a pandemic. And I think if we learned a lesson, it's that public health and healthcare is important to everyone. More people with health insurance will support that system. Thank you, Mr. Chairman.
Questions, committee? Thank you very much, Ms. Cartwright. Oh, I'm sorry. Ms. Hutchins, Senator Hutchins, go ahead.
Thank you, Mr. Chairman. Mrs. Cartwright, I appreciate your testimony. I was under the impression in our last committee that you received a lot of grants. That's why I was really a yay for the program that you have here. And I believe I am known for trying to eliminate all federal funding. So I'm not for one in one place and against it in the other. I just want to make that known. We just have to get off the dole. And when you talk about federal funds being used in this case, again, it brings into question, how much money does the federal government have to give you some here and then some there and then some here? We just have so many pots where we're pulling from the federal government. I just don't see how we can continue to do that. So thank you, Mrs. Cartwright. Thank you, Mr. Chairman.
Mr.
Comment, Ms.
Chairman.
Cartwright.
Yes, if I could, please. Again, I really appreciate this committee's support for a previous bill. And each of these health centers builds their whole book of business in a way that is appropriate to their community. So it does include foundation money and things like that. So it's a whole book of business, but they're called federally qualified health centers because they do meet federal requirements and they do receive federal funding. So thank you.
Senator Bouchard.
Thank you, Mr. Chairman. There was one thing you said that I agreed with. People want insurance. But Medicaid is not insurance. So how do you base that? I mean, people want insurance and their premiums have went up. I mean, we've costed it way above. I mean, we even tried to tax another insurance that doesn't directly cover healthcare. I mean, that was a bill that happened a couple of years ago, and we were going to put a premium tax on a different insurance to try to offset the costs of the premiums on Obamacare. So that's a whole different problem. Medicaid expansion will cost shift over, and as you know, providers are not getting enough reimbursement because it's a percentage. So I want you to think about what I just said. And then I'm one of the few people that was pushing against the Medicaid fraud problems that we've had in the state. And quite frankly, none of the lobby groups came and even wanted to talk to me about those issues. When we're talking millions of dollars in Medicaid fraud. It was just easy way to take money. Maybe people that weren't even, I'd like to go back and look at the fraud cases and see how many people should have even been on Medicaid in the first place. So, I mean, are you seeing the difference here between people want insurance and maybe we have a problem here that could get bigger if we look at Medicaid as replacing insurance?
Ms. Cartwright, go ahead.
Mr. Chairman, thank you. Senator Bouchard, by my definition, Medicaid is insurance. It allows people to go to the doctor, to avoid the hospital emergency room, to get care for their diseases, to do preventative care. Second to that, most Medicaid fraud by data proof is done by providers, not by people who are accepting Medicaid. And again, I would say what I said before, which is that if somebody wants to move from subsidies in the marketplace and purchasing insurance on their own to Medicaid, they would have to decrease their income. And so, yeah, that wouldn't be the right thing to do. But somehow there's this idea that you can jump back and forth. That's not as easily done as it sounds. So I would leave it at that. Thank you.
Thank you very much. Thank you for your testimony this morning. Move on down to the next person. Go ahead and introduce yourself.
My name is Jan Loftus. I'm a citizen from Buffalo. Thank you
Go
for
ahead,
letting me
testimony.
talk. There are three main institutions in our society: family, church, and state. Each has its own roles. Government exists to provide life, liberty, and property. Government's role is not to supply everything. 35 years after our Constitution was written, the House of Representatives in DC was taking up a bill to appropriate money for the benefit of a widow of a distinguished naval officer. Beautiful speeches abounded. And it was just about to be put to question when a young congressman rose and said, "Mr. Speaker, I have just as much sympathy for the sufferings of the living, if suffering there be, as any man in this house. But we must not permit our sympathy to lead us into an act of injustice to the balance of the living. I will not go into an argument to prove that Congress has no power to appropriate this money as an act of charity. Every member upon this floor knows it. We have the right as individuals to give away as much of our own money as we please in charity. But as members of Congress, we have no right to appropriate a dollar of the public money. Some of you might recognize that this was Congressman Davy Crockett. He went on to offer a week's pay of his own, him claiming to be the poorest member in Congress. If everyone would do likewise, no one did. A century and a half later, there was instituted a war on poverty by LBJ in administration. Pre-war government spending was small for welfare. Post-war spending has increased exponentially, and so has poverty. This bill is an agreement with another move towards single-payer healthcare. This bill is an unknown. The fiscal note says, estimate, 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 estimate 4 times. This bill is an injustice to the rest of the population and to the recipients, as evidenced by the failure in the war on poverty. This bill is, as Davy Crockett said, giving what is not yours to give. I think of my little grandson, a 1.5 years old. What has been said here today by some as to the federal debt, I think he is in debt $100,000 by our federal debt. How is that right to him? My kids, my daughter could have gone onto Medicaid because she was a student and her husband was working as a custodian. Instead, they've chipped away at a $5,000 copay and deductible. How is this right for them?
30 more seconds. Go ahead and wrap up and
Thank you.
go ahead.
And there are some other options. There are co-ops. There may not be perfect options for everybody in all situations, and that's a hard thing. Thank you.
Thank you very much. Questions, Senator Hutchins?
Thank you, Mr. Chairman. Mrs. Loftus, have you ever heard of MediShare or Liberty Share? These are, I guess, church kind of programs where people share one another's medical burdens. Have you heard of these programs?
Go ahead.
Thank you. Yes, there's co-op type share plans like that. And I'm not an expert on those either, but I believe that's a real good option. And as I said initially, there are 3 main institutions in our society. I had a cousin years and years ago with cancer, and family, extended family, helped out every month for years. So family is one of the main institutions. And then church. And I'd put in with church, charitable organizations. And so those are another option. Government does not have the role to try to solve every problem in society. It has its specific roles, but it doesn't have every role, and it doesn't succeed at everything.
Thank you very much. Thank you for your testimony. We'll move on down to the next person. Go ahead, ma'am, introduce yourself. Go ahead and speak to the committee.
Thank you, Chairman, Committee. I'm Marcy Kindred. I'm here from Cheyenne, Wyoming, Senate District 5. Shout out to Senator Lynn Hutchings. I've given testimony in about every committee hearing for a MedEx bill for the past 3 or so years. I come here and I give you my Medicaid expansion success story. 3 of my 4 children born on Medicaid. They attended all their wellness visits, received all care by the great state of Wyoming for the first few years of their life. As per my usual testimony, I urge everyone in Wyoming to consider how we speak about those people on those programs. I'm here to raise my hand and say, hey, it's me. I'm here, I'm your neighbor, I'm your friend. I'm here to speak to those that may be receiving help right now in the form of governmental assistance to let you know that I see you. I know you're working hard. You matter and you deserve care. Y'all are probably sick of hearing my story, and it's on record for anyone who wants to go look it up. So today I want to share another story. If you ever wonder why I'm so passionate about this subject, it's because I know a lot of folks that have been affected by our healthcare situation in Wyoming. I want to tell you today about my husband's grandparents. They're about as Wyoming of a couple as you can get. Grandpa Paul's a veteran. He and Grandma Pat raised their 4 children in Cheyenne and Rawlins. Their favorite vacation was camping in the Rawlins Desert. That was their idea of paradise. Grandpa Paul was an auto mechanic that worked well into his 70s, far past the age of retirement. He loved what he did, body work. He was a hard worker and he was good at it. So he kept working for years after we all started asking, when are you going to retire, Paul? He did finally retire. And over the years, it got to the point where Grandma and Grandpa couldn't make it down the stairs to do laundry. So we had to remedy their living situation. We got him a nice room over at Whispering Chase for about 6 months. However, even though he was one of the hardest workers I've ever known, a mechanic's retirement is a modest one, and their funds dried up pretty quickly. We tried to apply for more assistance, but the help couldn't come soon enough. Grandma Pat passed this year. She passed from COVID-19 in a nursing facility far from home in Colorado. Grandpa is currently in a nursing home in Greeley, Colorado. Another thing you should know about Paul is he very much dislikes Colorado. For years, he blamed the Greenies for the obscene amount of traffic over by King Soopers at 5 p.m. But he will spend his last days in a nursing home in Greeley, Colorado, and he's doing that because Colorado has expanded Medicaid. And they were able to offer him help and comfort in his last days. The major point of opposition I hear to this bill is that it's not the Wyoming way to accept funds or help from the government. We like to do it ourselves around here. But we're not doing it ourselves around here, at least not very well. We're pawning our elders across state lines. And that's shameful. Those are our people. In Wyoming, we take care of our own, right? I'd like to believe that. I'd like to make that a reality. Please pass House Bill 162 to help make it so. You have a Zoom room and a room here full of folks begging you to pass this bill. 2 or 3 have offered opposition, some of them, to borrow from the comedy classic Mean Girls, don't even go here. But there are professionals, providers, and citizens saying that this is what we need. If you don't pass this bill, you owe the people of Wyoming answers. This is your job. What are you going to do to help your people? You haven't offered other solutions. This is it. This is what we got. Please pass House Bill 162. I stand for any questions.
Thank you very much. Questions, committee? Senator Hutchings.
Oops, we've talked several times. Thank you. Even though I agree with you circumstantially, I'm trying to get answers to all the questions I have with all the reading I've done and all the letters you brought in yesterday. I've read several of them. I had to go home and do some more reading. But quoting Thomas Jefferson, he says, Congress has not unlimited powers to provide for the general welfare, but only those that are enumerated in our Constitution. James Madison said, if Congress can do whatever is in their discretion, if Congress can do whatever in their discretion can be done by money and will promote the general welfare, the government is no longer a limited one. My concern over and over and over, and I cannot seem to get a good answer to help me want to go forward, is we can help you by giving you money, but it's stolen money, borrowed money, printed money. Is that what you want us to do as a government? Thank you, Superlove.
Go ahead, reply.
Chairman, thank you, Senator Hutchings, and thank you for reading the testimony. I know it means a lot to your constituents. I don't have all the answers. I don't think any of us do. I know that this is a tool that we have, and we don't have many to help the sheer volume of Wyomingites that need this help. I don't see any other options. I haven't presented it, I guess, but neither have you. There aren't other options. Give me something. I'm good at giving testimony. If you gave me another option, I'd fight for it too, but I don't see it. This is it. This is all I see. If there was another option, it would have been presented already, but this is here and it's ready for us to use.
Thank you, Senator.
Thank you, Mr. Chairman. Just a really quick follow-up. I think we've seen in previous testimony or heard, you have the family and the church, you have those co-ops I think people can go to and seek assistance. So there are some options. We just have to be willing as people, responsible individuals, to look for those options on our own. So thank you, Mr. Chairman.
May I respond?
Go ahead.
25,000 fall into this gap that would benefit from this. It's 25,000 people that are not getting help from their churches. There are folks that don't have family. If you have family that has been able to help you when you're down on your luck, consider yourself lucky. You are lucky. Some people, we are that family. That's us. Wyoming is a rural state, and the only way we get through our long, cold winters is together. Your neighbors and your friends, and you are our neighbors, you are our friends. And this is the option that we have. Please, please extend this help.
Thank you very much for your testimony. We appreciate
Thank
it.
you.
And as a matter of fact, you are very good at testifying.
Thank you.
I don't know if there's a profession in that, but you should look into it. I'm just, okay, let's go ahead to the other end of the table and get more people up here. Go ahead,
Mr.
ma'am.
Chairman, my name is Cassie Craven. I'm here today on behalf of the Wyoming Liberty Group, and I want to hit a few key points on and against this bill. This isn't about these people or those people or us or them, it's about all of us. And today we have to make a hard decision. And I know that oftentimes hard decisions aren't easy to make. And that's why you're elected. You're policymakers. You have to make common sense, fiscally sustainable policy decisions. And I would put to you today that this is not one of those. First of all, I think that if we were to do this, and if we were to later want to get out of it, that poses several problems. First and foremost, I think at that point, there's an attached due process right, and people can sue you, because I can't think of any higher reliance argument than jerking away somebody's government-sponsored free healthcare. I think that the state of Wyoming will get sued if you try to get out of this. If we want to talk about the waivers, Ms. Cartwright just drove right by that one and said it's a non-starter. It's not. Go back and look in 2011 when 33 governors of their states petitioned President Obama for these waivers. They were denied. And as we sit here today, do you think that that outcome will change with President Biden, or do you think that it will get worse? We're already seeing work requirements not be allowed, and I won't lecture about the golden handcuff argument, but you're talking to a little girl who was raised in Long Pine, Nebraska in a trailer house. So we don't need to go down that road. But what we do know is once we're in, we're in. And we have no idea what that costs. We have no idea at the end of the day how many people are going to be enrolled in this program and how expensive and needy they'll be. Because as you just heard, Grandpa moved across state lines to get a little of that free healthcare. And I understand those arguments. I empathize with those arguments. But at the end of the day, you owe your constituents a fiscal sustainability answer. We don't even know how we're going to pay for the 10%. And in times when we're cutting programs for truly vulnerable populations, does this body really want to have a vote on providing free healthcare insurance to able-bodied working adults? Because that's what this is about. If we look at Montana, what you've been spun is not true. From 2015 to 2018, there was a 17 to 20%, 26% increase in the overall budget for their Medicaid expansion. That's less money for infrastructure, education, all the things that government should be paying for. And why? Because we're trying to get to single payer healthcare here, folks. And Medicaid expansion is a critical step in that, and proponents will tell you that. That's where this is going. It also pays pennies on the dollar for the actual cost, which means in Montana, in the first year they had this, hospitals had a 40% decrease in their profit margin. It might be a quick Band-Aid now, but let me tell you, when the audits start happening, they're going to think a lot differently. Because here's another fact for you that's not just riddled with emotional litany about how you don't care about your neighbor. 1 in 5 Medicaid expansion expenditures nationwide are fraud. That's a fact.
30 seconds.
Thank you, Mr. Chairman. We have no business doing this lapse in fiscal judgment. We can't afford it. And as with all free things, it sounds real nice at the outset. But at the end of the day, it's not good for us. And that's what this is about. This is about us, not them, not them. It's about the future of our state and what that's going to look like for all of us. And while it might be easy for you to go home and look your constituents in the eye and say, I got you free healthcare this year, how's it going to feel in 2 years when you jerk it away? And that will fall squarely on your shoulders. I'd stand for any questions. Thank you.
Questions? Thank you very much for your testimony. Go ahead. We're glad to see you wear your tie again today.
Thank you, Mr. Chairman. I'm Mike Lehman, representing the Catholic Diocese of Cheyenne in support of this bill. 6 years ago, this was actually the first bill I ever testified in favor of. And the question then was, if not this, then what? And when? And I watched the legislature for several years looking at doing studies, interim studies, looking for any other options. And here we are still. And so the question still remains. Prior to working for the diocese, I spent 13 years working as a firefighter in Fort Collins, Colorado. I want to make clear I commuted the whole time. Just I feel like it's important to show that I never actually bought a green license plate for my truck. But in that time, I saw something that it's been mentioned, but it can't be emphasized enough. The poor cannot be turned away from emergency rooms. So we're paying for it. They go in, but what is an emergency room designed for? It's not designed to get at the root of somebody's healthcare problem. It's to take care of the immediate symptoms, which very often get so unbearable that they don't know what to do but call 911. And so they go. So we're paying for it already. That's an important thing to remember as we consider this. This is not preventative healthcare, it's in response. I really appreciate the fact that these two bills came together this morning. Unfortunately, I feel like life has become a partisan issue for us. And I know there are all kinds of things to consider. I so appreciate the thoughtfulness and the questions that come about. But we're talking about two people who may be diagnosed with the exact same medical problem, which given our technology and our advancements today are perfectly curable. One gets treatment and the other one doesn't. And so with that, Mr. Chairman, just to encourage, I kind of feel like based upon the questioning that the cards haven't been held too close to our chest on this one for the committee, but would ask for continued discussion, because that is the question. If not this, then what? And it shouldn't probably be left to the 5 good senators on this committee. So I would ask for that consideration.
Thank you very much. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. Do you think all of your church has the same position on this? I mean, because if they do, wouldn't it be a better solution for the church to bring forth this solution, like providing healthcare and building their own hospital, instead of coming to the government and saying, let's just move forward on something that we're going to tax everybody? I mean,
Mr. Chairman, go ahead.
Thank you, Senator Bouchard. If you find 2 Catholics that agree on anything, would you please let me know? I've just expressed that. That is a good question. That has been raised, by folks that have raised that question. we're talking about a number of folks, and I know a lot of people are very generous, charitable, but that need is today for some folks. There's a reality that somebody will be diagnosed with a treatable illness today. And right now, there's nothing for them. There are certain programs out there, but is it comprehensive? Can people apply for it? Do they know how to do that? Those are the questions that we're wrestling with also.
Thank you. We'll do a follow-up. 1 second, Senator Bouchard. Mike, can you let somebody up on the floor know we're going to be a little late? Because we are going to finish this up. Senator Bouchard.
Thank you, Mr. Chairman. So I just want to follow up because I want to be clear here. I mean, my direct question was, is your membership in agreement? And what I got was a no. And I just want to be firm there that I have that answer.
Mr. Chairman.
Go ahead, sir.
Senator Bouchard, there are people that disagree on it. The Diocese of Cheyenne is in support.
Okay, thank you very much. Thank you. Go ahead, sir.
Thank you, Mr. Chairman, members of the committee. I'm grateful to you for this opportunity to speak in support of House Bill 162.
Could you go ahead and introduce yourself? I'm sorry.
Sure. My name is Joe Wadawa. I'm a resident of Cheyenne, also in Senate District number 5. And so what I would like to do in support of this, thank you for the reminder to introduce myself, is to share 2 accounts of the human need for this legislation. So the first account I would like to share is my own. At the age of 5, my immune system attacked my pancreas and disabled it and left me with a diagnosis of type 1 diabetes. So I've lived with this condition for the past 28 years. I mention my own diagnosis because I am one of the fortunate few of this unfortunate community of diabetics. I do have excellent health coverage and it affords me the best of care. Many insulin-dependent diabetics do not have access to insurance, since they also do not earn a wage that can support their out-of-pocket treatment. This condition not only poses a great medical risk, but also poses the constant threat of financial ruin. So to expand on this reality, out-of-pocket costs are prohibitive. 1 vial of insulin for me, which lasts close to 2 weeks and is classified as generic, costs $221. The supplies that I need to deliver that insulin into my body cost upwards of $4,000 every 3 months. So I do not pay these market rates, nor could I. Without insurance, these costs would amount to about $21,760 every year, with $5,764 for insulin alone. And I know that is very scary to those who are asking questions of cost on this committee. And I know that fear myself because I have to budget for that, or a share of it, that is. So the cost of staying alive not only directly harms many diabetics, but also prevents many of us from participating in the economic lives of our local communities here in Wyoming. The second story I would like to share is that of my future in-laws. My future father-in-law and his family came to Wyoming so that he could work in the oil industry, first in Douglas, before later moving to Gillette. For over 20 years, he did just that, working in the fields and laying pipeline. So both literally and figuratively, he worked to fuel our lives in Wyoming. Over 20 years of this work has taken a definite toll on his body, including a heart attack and a stroke he suffered 2 years ago. As soon as he went into the hospital, it became clear to him and his family that he and his wife could not afford to live in Wyoming any longer. In addition to his medical expenses, my future mother-in-law received a cancer diagnosis that required treatment. So after over 2 decades of living in Wyoming, building up an industry that propels our state forward, supporting their local community in Gillette, and raising their 4 children here, my future in-laws could not afford to be sick in Wyoming. It was prohibitively expensive. So they made the decision to move near family in California so they could receive the aid and medical treatment they needed. My future in-laws still miss Gillette greatly. My future mother-in-law will still tear up a bit when the topic arises of when the family terminated their old landline there. That decision cemented a move that she and her husband did not want to make. And each time—
30 seconds, go ahead.
Thank you, sir. Each time we have visited her parents, my fiance has remarked, and I agree with her, how nice it would be if we could go to Gillette instead of California. No one should have to leave Wyoming so he or she can afford to stay alive. Thank you for this opportunity to testify in support House Bill 162, Mr. Chairman. I'm grateful to you and the members of this committee. I stand for any questions.
We appreciate questions, committee. No questions. Thank you very much for your testimony, for coming in to see us this morning. We move to the other end of the table.
Good
Go ahead,
morning,
ma'am.
Mr. Chairman, members of the committee. My name is Cindy Delancey, and I'm the president of the Wyoming Business Alliance. The Wyoming Business Alliance and our 300 plus business leaders and members from across the state stand in support of House Bill 162 and really compliment Representative Romero Martinez for his work on this topic. I'm new to this conversation. I certainly don't hold myself out as any kind of healthcare expert, but what I can share with you as a business leader, only healthy people can work. Only healthy people can work. We need people who have access to healthcare within our state. It's a recruitment and a retention issue for business leaders. And this conversation is on the minds of all employers and employees across the workforce. I encourage you to pass this bill out of committee. Am I confident that this bill contains all the answers? I don't know. I seriously don't know. But ending the conversation today limits the discussion for yet another year. So I encourage you, especially in light of listening to the intense debate on the floor yesterday and the desire of the larger body of the Senate to have these conversations, I encourage you to pass this bill out and really listening to the subject matter experts, the hospitals, the doctors, the other healthcare providers saying that this is something worthy to continue conversation. I just encourage you to listen to those subject matter experts to help us find that Wyoming answer. So with that, Mr. Chairman, I'm happy to stand for any questions, but just wanted to remind the committee that this really is a business issue in addition to a healthcare issue, and encourage you to continue the discussion in some capacity. Thank you.
Thank you very much, Ms. Delante. Any questions? Thank you very much for coming to committee. Go ahead, doctor.
I am Dr. Ryan Jackson, and on this bill, I'm speaking on behalf of the American Cancer Society Cancer Action Network. So we've heard a lot of testimony from a lot of different organizations and individuals. What we're trying to do is help the people of Wyoming. The Cancer Society has looked at this in all the states that have expanded, and they've been able to see a significant improvement in catching cancer earlier and treating that cancer earlier. And not only does that improve the outcomes, that saves tens of thousands, if not hundreds of thousands of dollars. Because if you let the cancer go to the point where you have to do chemo and radiation, the outcomes aren't as good and they're much more expensive. We're looking at helping the working poor, the people who are trying their best to get by, and they can't afford the insurance coverage that is currently offered. The Affordable Care Act is not affordable. So if they buy insurance through the marketplace, even if they get a subsidy on their premium, they can't afford the out-of-pocket costs. For my own, which has lower out-of-pocket limits, it's $8,500 per year out of pocket, besides my deductible and my premiums. So imagine somebody who's making $12,000, $18,000 a year. Another $8,500 out of their budget is going to wipe them out. And I have spoken to many of my dear friends who are working nonstop, and some of them cannot afford to get better jobs because they have sick children. And so they have to keep earning less and contributing less to our government because they can't afford health care for their kids. And I know single mothers that have put off marriages because they can't afford to get married because their kids are sick. And these are decisions that we should not be facing. So this is not to support the supposed deadbeats. This is to support the people who are working their butts off and are trying to get up in life and get to the point where they can have a job that does come with benefits. So, thank you.
Thank you very much. Senator Bouchard.
Thank you, Mr. Chairman. You know, you hit on something that I know a little bit about.
California had everything that you could want to take care of people. And I've seen plenty of young couples who are on the books as not being a couple. And so that system has drove people to pretend they were something they were not. And that's what scares the heck out of me as we keep talking about expanding welfare. And the federal government will not allow us to put a work program in place. I see this as dangerous. I mean, you've identified it yourself. Don't you see that a state like California had all the bells and whistles and things that even early on before Obamacare? Don't you see us going in that same direction right now?
Doctor?
Mr. Chairman, Senator Bouchard. I see California has had some wasteful policies. And previous testimony has stated that the vast majority of Medicaid fraud has been from the providers and not from the consumers. So I support any effort to cut down on fraud in any way. And we already have the laws on the books, so let's enforce those. Now, I do think that when the insurance options that are available are so expensive, and the healthcare in Wyoming without insurance is ridiculous. I had to have an MRI a few weeks ago, and it was $4,300 in Casper. And almost any other state, it's about $1,200. So our people are facing an uphill battle, and so many of them cannot get to the point where they are self-sustaining. And I think that's wrong. So this is not to help the people who have no intention of working. This is to help the people who are already working and can't afford health care.
Thank you. Okay. Senator Hutchins.
Just a quick question. Doctor, I didn't get your last name.
Jackson.
Jackson. You said something early on that the ACA is not affordable. And we were promised it would be affordable care. I mean, it's in the words. What are we to assume with Medicaid? Thank you, Mr. Chairman.
Go ahead, Dr. Jackson.
Mr. Chairman, I agree completely on that with the affordable care is a misnomer in many ways. It is pointless to get tens of millions more people insured with an insurance that they can't afford to use. And I think that part of the problem is that it is so politicized that it's hard to talk about it without either offending the people who think that it is sacrosanct or the ones who think that it is all garbage. So what we need to do is get the people in the middle to talk about what is good about insuring our people and what is flawed about the existing system. And I think that's what we're seeing here. We have been discussing expanding Medicaid in Wyoming for at least 8 years. And so far, the opponents have not come up with any solutions. And many of the previous opponents have now shifted over to saying that Medicaid expansion may be the only way. So we've seen so many people in the House have changed their votes to now supporting this because over the past 8 years, they haven't come up with anything better that will help the people of Wyoming while not crashing our budget even further.
Okay. Thank you, Senator McEwen. My fear is, and I'm going to go back to something I said earlier, Mr. Chairman. 2008, I was capable of providing my employees health insurance. And then we had the Affordable Cares Act, which absolutely trashed my ability to help my employees. And this was going to be the wonderful answer. I think the joke was it's affordable. And now we're heading to another cliff
trusting an administration and a federal government that has time and time again, for lack of a better term, jacked us around. We don't even know what the strings attached to this money are. But I promise you, if we're getting money from the federal government, it's a bribe. They want something. And everybody's so excited about getting $1,400 of CARES Act money. And they don't realize that's going to cost them $14,768, and that's before the interest gets added in. At some point in time, I feel the pain. I really do feel the pain. But this program, I don't believe is even close to sustainable. And at the end of 2 years, the federal government will do what it does best. They will yank the carpet out from under us and leave us with a $200 million program at a time where we can't even afford to take care of our elderly as it is. So I guess I'm asking, do you believe none of that's going to happen?
Dr. Jackson, go ahead.
Mr. Chairman and Senator McEwen, I'm no great fan of the federal government, and I am very concerned about all of the free money being thrown around. But I'm a citizen of Wyoming, and I was born and raised here, even though I spent most of my adult life abroad doing humanitarian work and medical education. I worry about the people of our state, and I really want to see what's best for them. And I don't trust the federal government, but we haven't come up with a better option. So they've discussed, Senator Hutchings was discussing these other programs, private industry marketplaces and cost sharing things. But when we're talking about the very poor people who are just struggling to get by with their families, and $12 an hour used to be a pretty good wage in Wyoming, but now you can't support a family on that. And there's no way you can pay for your children's health care on that. Now, years ago, you would have been able to provide that health care for your employees. Now it's not sustainable. You can't do it. You can't afford to pay for the insurance at the rates that they are now because the costs went way up. And the cost of healthcare in Wyoming has gone up even faster. So we need to fix that. We need to do something for these people who are trying to get by. And when I hear about helping another, 24,000 children get insured, I'm not seeing a downside on that. So I know that there is cost, and I know that there is risk whenever you're dealing with the federal government. But when I see the hospitals, the business owners, the churches all coming together on one item, that's pretty uncommon. We all want to help these people. We all want to take care of the very sick. We want to take care of the children and the single mothers. Now, is this a perfect system? No. But again, we've waited more than 8 years for somebody to come up with another option. And it's not there at the moment. So I would recommend doing this, or at least sending it to the floor to debate, so we can come up with other ideas. We can make amendments. We can do something. But until we come up with a standalone program that doesn't involve the feds, then I don't think that we can just leave our citizens of Wyoming hanging high and dry and bankrupting our hospitals by having them have to go to the emergency room and make a $50 treatment turn into a $5,000 visit.
Okay, thank you. We're going to work toward wrapping this up so we get a vote. We need to get back to the floor.
Can I make one more comment?
One more comment, go ahead.
So I've heard from many doctors who have outlined what this will do to our healthcare system, and none of it's good. Montana shut down 20 rural clinics. They're trying to get out of it and they can't. So I'm looking at what's a responsible decision on this, and it's hard. And you're right, we probably need to look at something. But I'm not sure this is it.
Mr. Chairman, just,
Quick reply, go ahead.
yeah, quickly, I would defer to the Hospital Association and the Medical Society on those things, because as far as I know, they do support this.
Thank you very much. Let's move on to one final testimony here on the end, and you go ahead and have a seat, Dr. Jackson. We'll get somebody new up there. And I would forewarn everybody, we're gonna start shortening these testimonies up because we need to get back to the floor and we need to wrap this up. So go ahead and introduce yourself and
Mr. Chairman, Senator Baldwin, Committee, Carolyn Passano with the Wyoming Healthcare Association. I've heard a great deal this morning about unknowns, and I come here because I think there is an unknown that I should pass on to you. And before I do that, I'm wondering why we in business, churches, the medical end, why can't we, in this interim, instead of passing this bill, why can't we form our own group and start talking about what are some solutions? What's wrong that we can't do that? Do we need the governor to appoint somebody to be looking at this? We don't. We could come together. And I think I'm making a challenge here. I'm not sure. But I believe that it's too soon to pass this bill because there are unknowns. And mostly we don't know what's going to come out of Washington, D.C. this next year. And we can't plan for it. But I'm bringing you an unknown. It actually is something that we have passed, you have passed the budget for the next 2 years. And in that budget are many dollars that have been taken away that our state can no longer support what we were funding. And the nursing home industry actually is a part of that, taking away Medicaid monies to fund a new program, perhaps. And you probably don't even know that 5% is being taken away from nursing homes. And it was due to finding money out of the Department of Health in order to lessen your burden, my burden, with what we were doing. And it was 2.5% from the Medicaid budget and 2.5% of state funds as a match.
30 seconds.
Yes, a philosophical thing here. And I believe that we have a way to think in the interim. And I would love to be a part of the group if there is such a one that comes together. I believe that we will need some of your brains that know inside things that we don't. But thank you very much.
Just throwing a quick ad there is that there is such a group and they meet right now. And a few members of this group in the audience here and myself are a part of that group that are working towards those things as we speak. You go ahead and reply.
As it has come together and speaking has happened, I'm not being derogatory. It's just that nothing has come out. And here we are we knew the bill was coming. And it's like something doesn't work.
I will push back a little bit on that. Something is coming out and you will be hearing about that in the near future.
All right.
Frankly, we have a presentation that will be coming out and
Okay.
yeah, there is a lot of work has been done. There's a lot more work that will be done. That committee, that task force is not going away. We're making some solutions and we're working on that. So I don't know if that's any reassurance to
I
you or not.
stand corrected, and I'm glad to hear that. Yeah, just hadn't heard what was really
Stay tuned.
ready
It's
to
coming.
come.
It's
Okay.
coming. Thank you very much. Let's move to the other end of the table, please.
Thank you, Mr. Chairman. My name is Nate Martin. I'm the Executive Director of Better Wyoming.
I wanted to leave my wife out of this, but here we are again. When she was in graduate school, she one day started to have intense stomach pains. 24 hours later, after waiting for them to go away, they had intensified. She couldn't go to school. She couldn't go to work. And because she was a broke graduate student in the process of clawing her way out of poverty, she couldn't afford to go to the doctor either to get them checked out. 24 hours after that, she was curled up in the fetal position in her bed. Her roommates carried her to her car and drove her to the emergency room. By the time she arrived, her appendix had already ruptured inside her body. She didn't go to the doctor because she didn't have insurance and she didn't want a handout. Most people don't want a handout. Most people will put off care until it nearly kills them. The hospital ended up sending her a $60,000 bill. She couldn't pay it, but somebody did. We all ended up paying for it anyway, in the form of higher premiums, in the form of funding our hospitals and backfilling their uncompensated care. The legislature has looked at this problem for a decade, has not found a solution. And if you don't find a solution, just like a shooting pain in your stomach, it's not going to go away. The last time that this committee met, you all did the right thing. I didn't see anyone on the committee who was confused about what they were voting on. I saw people who were elected by their communities to come here and solve problems, weigh their beliefs against the realities and the needs of their constituents on the ground. And I understand that there were some people, powerful people, who were upset about that decision. But I promise you, for every person that was upset about it, there were many, many more in Wyoming and in your communities who were grateful. And if you do the right thing again today and pass this bill out of committee, that gratitude from your fellow citizens that you represent will only grow. Thank you, Mr. Chairman.
Thank you very much. Mr. Detail.
Thank you, Mr. Chairman, and I will be brief. Travis Deti, I'm the Executive Director of the Wyoming Mining Association. We represent the state's coal companies, trona, uranium, and bentonite producers. We also represent two companies that are currently exploring for rare earths in Wyoming and a company exploring for gold here in Laramie County. My industry is not monolithic and my membership is split on this issue. So we are neutral on the bill, but I wanted to just give a couple of things for the committee's consideration. My number one priority in the past several legislative sessions is to keep the tax burden on our industry from growing. In particular with our coal industry, it's the most taxed industry, I would say, in the Wyoming, definitely, and in the state or in the country, one of them. And some of the discussions that my membership has had is that should the committee and should the body move forward on this, nothing certain, but I have members that feel that it would ease that tax burden and that the desire to raise taxes on the industry. I can't count how many times I've been before the Revenue Committee saying, no, 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 don't raise the sales tax, don't raise the property tax. And it's just the way our system's set up. Our tax burden falls disproportionately on the minerals industry. And again, that comment, just for consideration, that some of my members feel that should this go through, it would ease the pressure of tax increases on the industry. That said, Mr. Chairman, interesting debate, and I would stand for questions.
Thank you very much. Questions, committee? No, thank you very much.
Thank you, Mr.
Thank you. Josh, that brings up you.
Mr. Chairman, members of the committee, Josh Hannes with the Wyoming Hospital Association.
Mr. Chairman, committee members, Eric Boley with Wyoming Hospital Association. I'll kick it off quickly, and then we won't spend a lot of time, but there's been a lot of misinformation delivered here today, especially when it comes to Montana. And we can provide you with many, many documents that would show that Montana was actually a success. And a lot of the things that have been shared here today are incorrect. And so we're happy to share that with you. We've shared all kinds of data with you for 8 years. I spent a lot of time thinking about what we could add that might change your mind, might give you more comfort in voting the right way. But I'm going to let Josh spend a couple of minutes talking about Montana. And then I just have some comments that I'll close with.
Mr. Chairman, very quickly, a lot of comments about Montana today, just to offer a few points from our perspective. The talk about Montana not wanting to remain in Medicaid expansion is inconsistent with our conversations with partners in Montana. Montana has experienced budget savings every year since they have expanded their Medicaid. They were able to move services that were paid for out of general fund into the Medicaid expansion group. They got in early. Their FMAP was above 90% for a few of those years. They are down to then 90% FMAP along with the other states. They continue though to project budget savings into this fiscal year. Again, our conversations with our partners in Montana indicate no attempt or desire for them to leave the expansion group. And as stated before, getting out is a state plan amendment. If Franz is on the phone, or if any of you want to talk about the mechanics of that specifically with him, I'm sure he can describe that. I'm a little puzzled by some of the comments around Montana saying, well, they expanded Medicaid and then they had more people on Medicaid. Well, yeah, you're extending coverage to more people, and a significant proportion of that is being covered by federal funds. Uninsured rates of course decreased, uncompensated rates have decreased. That's been the experience from the other 30 some odd states that have expanded. It's clear in the literature that the benefit to hospitals is a net positive. And I guess I'd finally just turn your attention one more time to our own state Department of Health's report. They predict a decrease in premiums on the individual market on the exchange. They produce a net increase revenue to providers. Yes, there will be more Medicaid patients that reimburse at a lower rate. That crowd out is considered in their model. And I think that's been discussed extensively and explained.
30 seconds.
With that, I would finish by saying what I said to the Joint Committee earlier this week, is that I don't think anybody in this room is okay with our uninsured rates. I don't think anybody's okay with poor health outcomes or the uncompensated care burden that hospitals shoulder. So if we're not okay with it, this is an option that is on the table that produces net benefits to the state and to patients in the hospitals. And I'd suggest we move forward.
Thank you very much. Wrap it up. Oh, question. Go ahead, Senator.
Very quickly, Mr. Chairman. Montana has a income tax. And they also have hospital taxes.
They have a provider tax, Mr. Chairman.
Per bed, and they have 0.90% of 0.90 of outpatient services on the tax on the revenue. So are you willing to put that? I mean that's what we got happening here is somebody's paying for this. I don't see that model here because it's not just the federal government paying for it.
Mr. Bowley, go ahead.
Mr. Chairman, Senator Bouchard, great question, but again, not completely true. There is a provider tax up there that brings in $120 million a year, different than what we do here, where they do tax themselves and bring in additional money. So we'd be happy to do that here too. And yeah, we would be willing to be part of the solution if there's ever one that's offered to us, if it makes sense. But there is a pay for this. We've already talked about it. There's money that will come in through the additional FMAP that'll pay for this for 2 years, and we'll pay for it into perpetuity if we do this right. So there is a pay for it. I think our hospitals would be willing to discuss that, but we don't even have some of the same situations that Montana has when they pass the provider tax that they've been receiving $100 million a year for years. So we're comparing apples to oranges, but I will tell you, there was a statement that said that 40% decrease in revenue in the hospitals in Montana. That's false. They've all seen increases in their revenue. They've also seen decreases in their uncompensated care and their charity care. It's been a boom. Their critical access hospitals are in better shape than they've ever been. We never talk about Colorado, which is one of the greatest examples. They're actually under scrutiny down there because their hospitals are doing so well. And they haven't lost one critical access hospital. They actually have higher revenues and they have profit margins, which is something ours don't have. So there's a lot of misinformation out here. I think the thing that I would like to say is I've listened to this for 8 years and I challenged you guys during our interim topic committee meeting on Monday. If not this, what? And if not now, when? We've kicked this can down the road. I listened to the Senate debate yesterday and I listened to Chairman Scott, who I respect greatly, say this is a complicated issue. Well, it is, but we're not doing anything to fix it. And I would push back and say, it's time we do something. We have turnover in the legislature and then we have to start over again. This is the time to do it if we're going to do it. There is a pay for, and it is paid for, and we are all paying for it, whether we have expansion here in our state or not. We're all paying for it right now. We're paying through our taxes and other states are benefiting from it. I'm an Eagles fan. And so I like Hotel California, but I like AC/DC better. And I challenge you to pass this out of committee and let it be debated on the floor. And AC/DC would say, for those about to rock, we salute you.
Just don't sing it, okay? Okay, let's go. Thank you very much. I see 3 jumping up. A bunch of old guys, you jump pretty well. Okay, you can start whichever end of the table you want. You can fight amongst yourselves.
I'll start in the middle. So thank you, Mr. Chairman. Very quickly. So give us a bill. I heard in testimony in education on the charter schools, the majority floor leader on the Senate side, give me a bill so we can work it during the interim. That's what I'm asking for. Because I'm a business guy, had close to 300 employees. I couldn't afford insurance for my employees. But give us a bill so that we can work on the percentages. The FMAP, I believe, and I believe this, the Senate Majority Floor Leader also believes we can do better in negotiating if we've got some better parameters in this bill. So amend it on the floor as you wish. So the 90-10, that I believe we can negotiate up. I also believe the FMAP, we can possibly negotiate up past the 55. I also believe that we can negotiate a long-term deal. This is a unique opportunity, but we've got to have a bill to negotiate this. We have studied this to death. We don't need to study it anymore, with all due respect to Ms. Pazin. And now is the time. We failed as the Republican Party when we controlled the Congress, we controlled the Senate, we controlled the White House. Why did we fail on repeal and replace? Because the Freedom Caucus wouldn't negotiate in good faith. Our own party. And is that what we're going to have for Wyoming? I say not. So I just say now's the time. Pass this, amend it as you see fit, as the majority floor leader sees fit, so that we can get to the negotiating table and pass this forward.
Thank you much. For the record, would you tell us who you are?
Well, I'm Pat Sweeney, House District 58.
Said in a very soft voice, Senator Bouchard.
Mr. Chairman and Representative Sweeney, you know I have respect for you. We work together on issues. But I'm going to take a dig, man. You're blaming the Republican Party for the bill that Nancy Pelosi said, let's pass it so we can see what's in it. Now look at the mess we're in. It's just not a fair swipe to blame it on Republicans.
Okay, with that aside, let's move on to the next testimony. Representative Harshman, go ahead.
Thank you, Mr. Chairman, and thank you for hearing the bill committee, and you've heard it twice, so blessed are you. And it's the same bill that you passed previously, and I think a couple things, you know, and I've been, this is my 19th session, born and raised in this state, was chairing appropriations, voted against this, I think 7 times. Came to me as the House Appropriations Chair, you know, and it was tied 3-3. There's 7 members in House Appropriations. I cast a deciding vote multiple times. My co-chairman, so I kept it from going to the House. Governor Meade at that time showed a way to pay for it through the existing healthcare budget that budget's since been cut. And then my co-chair, your senator, who was your previous Senate leader, you know, served in the state nearly 30 years. He said to me once, he said, why can't I buy into the state healthcare system? And so we studied it, had a study in appropriations, put it in the budget bill, studied it, and couldn't do it. Then we studied a concept called cowboy care, where we could get employers to try to buy into cheaper insurance. Wyoming is unique because we are so rural. We all know that. And then we have this leakage, you know, people in this county go to Colorado, people in your neck of the woods go to Salt Lake, you know, us in Casper, Gillette, maybe a little bit of Rapid City, but Sheridan can go to Billings, but Fremont County and Natrona, it's Casper. We all want all these services in every little hospital. And it's terribly expensive. So we've studied all these plans. I think of the important part of this thing, why I've voted in favor of it this time. So I'm 7-1, I guess. And I think the current speaker changed his vote to the current chairwoman of Labor Health changed her vote after all these no votes. First of all, who is it? I mean, we're talking about half the people are under 35, mainly women. Most of them have kids. That's the biggest majority we're talking about. So we're talking, this is all about people, right? And then the other big group is about another third are elderly, 50 to 64. And most of them are working. I think the thing that changes this proposal is the FMAP. When I was a freshman legislator, I heard the FMAP change. I didn't even know what it was. And it dropped to 50-50. I didn't even understand it. It wasn't even in my stuff I was interested in. Well, Wyoming pays 50-50, and it's based on our average state household income. And that's gotten skewed because of Teton County. Teton County is 230,000 average household income, right? And the rest of us then are under 55 if you do the rest of the state. And so then when we do that weighted average, Wyoming's average household income is 62,000. And it takes us from that under 55 to over the federal average of 57,000. That's why we're 50-50. 30
seconds, go ahead.
Okay, that's why we're 50-50. And you look around, Montana's 65, Idaho's 70, Utah's 70% FMAP. It's millions of dollars to their state. And so really this bill gives us the opportunity. And so you heard all this talk about Montana, and these aren't Montanans who are bringing you this. So I called the guy when my former job I did that the House members elected me to do, and I was proud to do it and honored to do it. So you meet other people in those jobs. I called the guy from Montana, real Montana guy who's been right in the middle of this, voted against it every time. He said, it didn't bankrupt our state. It certainly helped our rural critical access hospitals. He said, did I vote for it? No, but it doesn't bankrupt our state. And then finally, I just would say, Mr. Chairman, to wrap it up, that had a call from a former Virginia state House member, now works in this current administration. She said, I told her, I says, we are not going to do this unless we can increase our FMAP because it's not right. We're lower than the 6 surrounding states average. The average of our states is like 68%. We're at 50 because of Teton County. And it's not right. And she said, put in the bill whatever you need to, we'll work with you. And I think this gives us an opportunity to negotiate that because Wyoming is kind of weirdly impacted by one county. And so I think we have an opportunity. And finally, Abe Lincoln says, when you decide on something, it's not whether it has any evil in it. It's, there's evil in everything and there's good in everything. And the question is, what's the balance? And does it have more good than evil? And I would submit to you, Mr. Chairman and members, I've always prided myself as the most pro-life speaker in the history of Wyoming. These are lives too. And I think I've come full circle on this because there's not a better plan. None of you have it. I don't have it. And it's not out there. And so I'm going to vote for it, and I'd hope you'd pass it on to the rest of your body. And I've done a few of those. I've said in committee, hey, I'm going to vote for the whole Senate to hear this, the whole House, but I'm going to vote no on the floor. And I think that's the right thing to do. So thank you, Mr. Chairman.
Thank you, Representative. Senator Rothfuss.
Thank you, Mr. Chairman. And that's what I'd ask for as well. This is a debate that we should have on the Senate floor. I think you've all heard me say that a few times, and I think it's a fair statement. I think the people of Wyoming deserve that. I think the people of Wyoming deserve the opportunity to have all of us weigh in, all of us that represent them through the Senate. I understand this is a challenge, and I've been involved in this discussion for as many years as we've been having the discussion, and this is certainly not my first rodeo. Feels a bit like a game of whack-a-mole. We try to address one concern and the other concerns come back up at the end of the day. And I understand all of those concerns because again, they're challenges, but throughout the whole discussion, I have always said to everyone willing to work with me and others, if you have a better idea, I want to join you and support you on it. I'm not married to this solution. It's just really the only one that has been on the table. Other folks have said, well, what if we do this? What if we do that? This will provide some solution. When you dig into the numbers, none of them do, because it turns out we're talking about for a biennium around $200 million. You can't just fabricate $200 million. And it's a shame that we have to get it the way that we would get it. We do know that there are substantial savings, largely through mental health coverage that we don't provide coverage for now that we would realize. Hard to calculate that. We know that for the first 2 years, it's fully paid for. And in fact, if you just took the money that we got net and extended it, you could pay this for over 4 years in terms of the administrative cost. 4 years where we come out ahead net as a state, where we can explore alternatives, we can have the discussions, but during those 4 years, we would be providing access to affordable health care. And it's not insurance people want. It isn't. It's access to affordable health care. They don't care how they get it. They just want to not die. They want to be able to go get healthcare service provision when they need it. Not just for emergent care, but for chronic care, for ongoing concerns, for the cancer treatments. We don't provide any opportunity for over 10,000 Wyomingites. It's not 500. It's over 10,000 that are below that 100% of federal poverty level. They have no alternatives. No alternatives when they get a $60,000 bill or a $100,000 bill, or they have cancer treatment that's necessary. No alternatives. There's nothing else out there.
Please, 30 seconds.
They can't join the exchange. And these are the types of discussions we should be having in the full Senate. I think each of you today has appreciated the experience and the discussion and the opportunity to debate. The Senate has not had that opportunity in years. And I'd ask each of you to provide us with that opportunity today. Thank you, Mr. Chairman. Thank you, committee.
Thank you, Senator. I think we're actually going to close public comment and get this moved. We need to get onto the floor. Unless somebody out there's got some new information, something new that we haven't heard in the last 3 hours. It just seems like a minute ago, I know. I think we'll go ahead and close public testimony. Would somebody like to move the bill? Senator Murphy's moved the bill. Comments, suggestions? Go ahead, Senator Hutchins.
Thank you, Mr. Chairman. I did want to ask the three gentlemen some questions. And I think one of the biggest, and it was brought out in testimony earlier, is this the proper role of government for us to get involved in providing for medical care access for our people. It's a good thing. It's a compassionate thing. But when I came into the legislature, or before I did, I was told, this is the way you should think. Is it constitutional? Is it based on someone's circumstance, or is it based on what's constitutional? So I asked myself, is this found in our Constitution? And I can't find it there. Does the solution call for free markets, free market answers, or governmental control? Is it based on expediency, nice benefits, or the lesser of two evils? Or is it based on true principles? Does the solution make me more dependent on government or more free from its control? And as I studied and I asked people questions over and over and over, I never got answers that I thought were constitutional. It was all emotion. It was all circumstantial. And I think we on the committee are kind of gatekeepers. We hear the testimony, we hear everything people have to say, and then we make the decision. Should we push this forward to hear the same things over and over again? That's what I'm hearing we're gonna do. So those are the questions I didn't hear. I know pregnant women are already covered, elderly are covered, disabled are covered. And I've heard Medicaid is not an insurance. It is, it's a subsidy. And I heard there are so many unknowns. And I also heard something from you. There's something else out there. And I'm willing to listen to that as well. Thank you, Mr. Chairman.
Would any one of the three of you like to respond to that real briefly, or you don't have to? So.
Just briefly.
Mr. Chairman, I think it's a classic question when you settle in your seat and you have to vote. It's not easy, and there's more to the story. And I think too, as government, should government be a bank? We just voted for a budget. We're gonna put nearly 60 million in the permanent reserves forever. Wyoming is a wealthy state. And I will tell you, senators, I regret that May Craig last year. I probably could have stopped it as speaker. Scared the heck out of everybody. Wyoming is an incredible wealthy state. We don't owe anybody any money. We're conservative. We pay our bills. We pay with cash. And we're going to save 160 million in the permanent funds forever of today's tax dollars. And we're going to grow the LSRA with today's investment earnings for tomorrow's people by 200 to 500 million in the next year and a half. And we made some really tough cuts. I talked to Senator Scott. He was opposed to the cuts in the Department of Health. You're well aware as chairman, went too far. And so I just think, is government a bank? How much money should we save of today's people's money for people tomorrow? I think that's a moral question too. And so with that, thank you, Mr. Chairman.
Thank you. Committee members, further comments, questions, statements? Well, and I would say to Senator Hutchings, in that there is something out there. We're working on something. I won't say that we have an answer. I won't say that there's even a solid framework. But in the meantime, if that takes 3, 4, 5, it takes a long time to build those kind of things. We've got an issue on the table in front of us, people without insurance, a number of people as we speak. And I do think it's our role to protect the citizens of the state of Wyoming. And this is my opinion only, and I know everybody knows what they're going to vote, but I think it's important that, we have a lot of new members in the Senate, and we have people that have never heard this issue. They've heard 1 or 2 members tell them about it, tell them how bad it is or how good it is, and they don't know. They've read the emails. We've read the emails about Montana. Some of those facts are true. A lot of them weren't. And you all know that. This morning, I came in at 5:30, and before I came down here at 7 o'clock, I'd already had 200 emails about this issue. Most of them were form letters. Those people didn't know what the facts that they were telling me. They were just sharing a form letter that they'd shared or been told to share. And I don't know that that's always accurate. So would be my opinion, again, my opinion only, but I think we have new people. I think we have new senators that haven't heard this issue. And I think it's important that it's an issue that, a conversation that needs to be had. That may or may not be your opinion, but that's my opinion. And that's where my vote goes. And that's why I'm a yes vote. I think it's an important bill. I think it's important for the state of Wyoming. I think it's important for our citizens, our hospitals, our doctors, everybody across the board. And with that, are there further comments or questions, or are we ready? Oh, go ahead, Senator Bouchard.
Thank you, Mr. Chairman. As you know, I have heard this issue before. There was I guess, a reason that leadership wanted a ranking member to stay on this committee, and that, I guess that would be me next to you. But I've kept asking the tax concerns over and over and over, and I do appreciate that the hospital says they're okay with taxing themselves, but that's not really where the tax. It's still going to come out of taxpayers that pay more with that increase. It gets passed on to them. So I just wanted to add, I think, I've been on this committee. First committee I served on, Chairman Scott took me under his wing and showed me a lot of things that were happening in the background. And I'm just going to say I'm glad he did. So just wanted to add that.
And Senator Scott has very big wings, I might add. Longest wings in the Senate. If we're ready for the vote, Senator, let's go ahead and call the roll, Mike. Oh, go ahead. One more comment. Go ahead.
I just want to add, so the people will know, we've had this bill on file for quite some time. And I look at myself as someone very easy to find, very easy to spot in the legislature. And I see people going from member to member to member talking. And I don't recall too many of you that are for this. Senator Hutchings, can I sit and talk with you? I want to tell you my side. And I haven't seen that or heard that. And I'm open to listen to anybody. So I just want the public to know this bill has been here and I have not been approached by anybody. I did talk to Representative Sweeney once in the hallway, and I appreciate that. But other than that, I've been on my own or super loaf over there, and truly, truly appreciate all the input and the hundreds of emails we've gotten on both sides. Thank you, Mr. Chairman.
Okay, let's go ahead and take the roll, Mike.
For House Bill 162, Senator Bouchard. No. Senator Murphy.
Aye.
Senator Hutchings.
No.
Senator McCune.
No.
Chairman Baldwin. House Bill 162, 2 aye, 3 no.
That completes our meeting. Committee members, before we run away, we got one more thing we got to do off the record.